Good evening, all. Today we will be discussing AIAPGET 2024 question paper. I am Dr. Aarathy from Drona Institute. So, question number 1. It is a match the following regarding a few X-ray findings and the disease, corresponding disease. So the question given is snowstorm appearance, snowman appearance, water bottle configuration, egg on side appearance. These are the 4 X-ray findings given. And the 4 diseases given are pericardial effusion, transposition of greater arteries, total anomalous venous return, and miliary tuberculosis. The option is 4. Correct option is 4. So let's see one by one. Snowstorm appearance. Snowstorm appearance is a chest X-ray or CT finding, which is found in miliary tuberculosis. So this snowstorm appearance is because white fluffy shadows are found all over due to scattered, nodules, tiny nodule opacities. That is why it resembles snowstorm appearance in chest X-ray. So this is found in miliary tuberculosis. The differential diagnosis of this disease would be sarcoidosis, thyroid CA, certain fungal infections. All these can have the same snowstorm appearance in a chest X-ray. Similarly, we have a snowstorm appearance in USG finding, which is in hydatidiform mole. Same way, if you find a snowstorm appearance in a musculoskeletal area in a X-ray or CT, then it can be gout or pseudo gout. So these 3 points you can note down there. Now moving on to the second condition, that is snowman appearance. Snowman appearance, the shape of a snowman, right? It resembles the figure of 8, right? So this is also called figure of 8. Now, how does this figure of 8 come? This figure of 8 has 2 zeros or 2 circles, right? One upon another. So actually, the upper bulge is because of the dilated veins of superior vena cava, dilated veins like superior vena cava, left brachiocephalic vein, etc. And the lower bulge is due to the dilation of heart. Actually, these 2 dilations form the figure of 8. And in which condition is it seen? It is seen in total anomalous venous return. If you find the same figure of 8 appearance in a brain CT, then mostly it would be associated with pituitary macroadenoma. So we have discussed snowstorm appearance and snowman appearance. Okay. Now moving on to the third X-ray finding, which is water bottle configuration. Water bottle configuration, you might have seen the old age water bottles, which is a round bottomed flask like water bottle, right? That is what the shape you would be finding in the X-ray. So that shape is formed due to heart enlargement. Okay. It is mainly due to pericardial effusion. What do you mean by pericardial effusion? Liquid collection or fluid collection in the pericardium. Okay. So this is actually due to chronic and severe dilation of the heart chambers, which alters the normal shape of the heart. So usually you have pericardial effusion also and cardiomegaly also, right? Heart, increases in size in both these conditions. So you can differentiate the cardiomegaly as well as pericardial effusion with this classical water bottle sign, because only when you have liquid collection or fluid collection as in pericardial effusion, the heart assumes this particular shape. Now, the fourth one is egg on side appearance, right? Egg on side appearance, which is found in transposition of greater arteries. What do you mean by egg on side appearance? If you keep an egg sideways, what shape will you see? That is what you see in the X-ray. So this is a classic chest X-ray sign found in cyanotic neonates. Okay, neonates, newborn children who are cyanotic. And what is exactly the condition? We all know that from left ventricle aorta and from the right ventricle pulmonary vein, right? Pulmonary artery arises, not pulmonary vein, pulmonary artery arises. Now in this condition, what happens is these 2 interchange the positions. That is, aorta originates from the right ventricle, while pulmonary artery originates from the left ventricle. And what happens? Impure blood gets circulated, right? And that is the reason why cyanosis happens. And in such cases, you can see a classical finding of egg on side appearance in the neonates chest x-ray. Okay, so all the 4 conditions have been discussed here. So snowstorm appearance, it is seen in miliary tuberculosis. Snowman appearance, it is seen in total anomalous venous return, and water bottle configuration is seen in pericardial effusion, while egg on side appearance is seen in transposition of great arteries. Now moving to the second question. Progressive chronic destruction of more than 90% of the adrenal cortex on both sides causes Addison's disease. And statement 2 says tuberculosis and metastatic cancers of the adrenal glands are implicated in the majority of the cases of Addison's disease. So before going to the question, you need to have a small idea about what are adrenal glands, what are the secretions, and what happens when the secretions are not following the proper method. Okay, so what are adrenal glands? Adrenal glands are 2 triangle-shaped small endocrine glands placed on top of the kidneys. Okay, what role does these adrenal glands have? They have role in metabolism, immune functions, BP regulation, stress response, and as well as development of sexual characters. So this adrenal gland has 2 different areas or 2 different parts. That is, it composes of outer cortex and inner medulla. Okay, 2 regions of this adrenal gland. Now you need to know what functions or what secretions does adrenal cortex produces and what secretions does medulla produces. Now coming to the adrenal cortex part, the cortex part is again divided into 3 parts. Like the outer zone. Outer zone is called glomerulosa, and this glomerulosa secretes a mineralocorticoid called aldosterone. You might have heard about aldosterone. These are BP regulating secretions. How do they regulate the BP? By regulating or by controlling the sodium and potassium levels, as well as maintaining the blood pH. Okay, so this is what aldosterone does, and this is secreted from the outer zone of outer cortex, and this outer zone is called glomerulosa. And now coming to the middle portion of the adrenal cortex, middle portion is called fasciculata, and from here cortisol is produced. So what is cortisol? It is a glucocorticoid, and cortisol must be very familiar to all of us, right? It is released during stress situations to boost up our energy. Okay, now inner zone of the adrenal cortex, what is that called? It is called zona reticularis, and this portion secretes androgenic steroids or DHEA. What are these androgenic steroids? They are weak male hormones that get transformed into female hormones, or it is female hormones when it comes to the ovaries, and male hormones when it comes to testes. So inner zone or zona reticularis secretes the androgenic steroids, which are converted into corresponding sex hormones. Now, adrenal cortex, three areas, what all they secrete, that is clear. Now, coming to the inner area or the inner medulla of the adrenal gland. So, outer portion we have discussed. Now, coming to the inner portion. So, the inner medulla, what does it secrete? It secretes adrenaline and noradrenaline. It is a fight or flight hormone, right? Adrenaline and noradrenaline are called fight or flight hormones. They belong to catecholamines, or they are called catecholamines. And how do they, help in this fight or flight situations? They increase the heart rate. They pump more blood to the muscle tissues and brain, and causes us to make a response, a quick response to the situation. That is why they are called fight or flight hormones. Okay, and how do they get the energy, or how do they assist in producing the energy? They assist the glucose metabolism in the muscles. So this is how they work. So this is actually the structure and the functions related to the secretions of adrenal gland. Now let's see what is Addison's disease. Thomas Addison described this condition first in 1855. It was commonly due to autoimmune destruction of the adrenal cortex. And when it was discovered in a patient, the patient was having this due to tuberculosis of adrenal glands, attributing it to mainly bilateral adrenal destruction. Due to what? Due to Mycobacterium tuberculosis. So the patient was a tuberculous patient, and a bilateral progressive destruction of adrenal gland was happening over there, and that is where Addison's disease was first detected. Okay, so in Addison's disease, what happens? Either glucocorticoid or mineralocorticoid deficiency may come first. That is, outer cortex, the outer area of cortex and the middle area of cortex are responsible for secreting mineralocorticoid and glucocorticoid respectively, right? So in Addison's disease, what happens? Either of these would be deficient in the initial stages, and later on what happens? Bilateral adrenal cortex, the cortical area alone gets degenerated, and hence what happens? Later on, both glucocorticoid and mineralocorticoid deficiency happens. Now, TB can destroy the adrenal glands through granulomatous infection, leading to primary adrenal insufficiency. Okay. Now, what happens in the pathology? Adrenal glands show total cortical atrophy. Cortical atrophy means adrenal cortex alone gets atrophied, so that all the three areas, the hormones or the secretions from all the three areas goes down. While medulla area, inner medulla area is completely normal. So there is no problem with adrenaline and noradrenaline secretion. Now, in the primary form, what happens? Histology shows lymphocytic infiltration. How does this atrophy happen? In the primary stages, lymphocytes infiltrate into the cortical area and the tissues are converted into fibrous tissue. Now, that is how the atrophy happens. Okay. In tuberculosis of the adrenals, evidence of tuberculosis in the body may or may not be present. There can be an evidence of tuberculosis, or there cannot be an evidence in the body, even if the adrenals are affected. And patients may show adrenal enlargement or calcification. Clinical. So how is this disease detected? Through clinical assessment as well as investigations. So patient may present with chronic features or acute circulatory shock. Main problem is inability to combat stress, and clinical features are determined by the severity of stress and its nature. Why is it inability? Why is the inability to combat stress? Because the glucocorticoid is not being secreted over there. Now, the initial symptoms would be vague tiredness, weakness, lethargy, weight loss, gastrointestinal problems like vomiting, etc. Then dark pigmentation would develop, vitiligo, etc. would be the initial symptoms. While when Addison's disease fully manifests, you can see the symptoms like characteristic pigmentation over face, palms, sole, extensive aspects of limbs, and excess adrenocorticotropic hormone. What is this ACTH? ACTH is actually secreted from the anterior pituitary, right? It is a trigger hormone asking the adrenal glands to secrete more of these glucocorticoids, mineralocorticoids, and other hormones from the adrenal glands. So why is it excess in blood in this condition? Because as and when ACTH is released from pituitary, in response, adrenals should release the hormones. But here what happens? Since adrenal gland is not responding by releasing the hormones, pituitary thinks that it has to release more ACTH in order to make the adrenal glands to release the corresponding hormones. And that is how ACTH levels are increased in plasma, while actual hormones which are to be released from the adrenal cortex are declining. Okay. Now, hypoglycemia is seen, hypercalcemia, hyponatremia, and in cases of women, they develop amenorrhea, and men develop impotency. So these are the symptoms which you can see when the disease fully manifests. Now, laboratory, with these symptoms, along with these clinical presentations, we would be going for laboratory investigations. Like in Addison's disease, as I said, plasma ACTH levels are very much high, and correspondingly, plasma cortisol levels would be very low, since there is no secretion of hormones from adrenal glands in response to the ACTH. Then Addison's disease should be suspected clinically and confirmed by investigations. Now, as for differential diagnosis, chronic malnutrition, malabsorption states, megaloblastic anemia, tuberculosis, disseminated malignancy, and psychiatric disorders can be considered for differential diagnosis with Addison's disease. Now, what about metastatic tumors? Metastatic tumors can destroy the adrenal tissue bilaterally, which again mimics Addison's disease, but it is very rare. It is not very common. So mostly primary Addison's disease is autoimmune based or due to the infection like tuberculosis affecting the adrenal cortex. So coming back to the statements given in the question, they've said progressive chronic destruction of more than 90% of the adrenal cortex on both the sides causes Addison's disease. Yes, as we have discussed, adrenal cortex is being atrophied while adrenal medulla is intact, right? So the statement 1 stands true. While coming to statement 2, tuberculosis and metastatic cancers of the adrenal glands are implicated in the majority of cases of Addison's disease. Yes, tuberculosis can be seen or can be associated with primary Addison's disease, while metastatic tumors are not that common with presence of Addison's disease, right? And that point makes the statement 2 false. I hope that is clear. Now, moving on to the third question. Out of the following, which is the fibrous septa that supports the breast? So the options are cardinal ligament, Cooper's ligament, McEnroth's ligament, and broad ligament, right? Now, seeing the options itself, it is very easy to choose the answer, because cardinal ligament or McEnroth's ligament, both are the same, one and the same, and they are the support of uterus and not the breast. Same way, broad ligament is also the support of uterus and not breast. So the only ligament related to breast is Cooper's ligament, and that is the answer. So McEnroth's ligament is also known as cardinal ligament, or it is also called the transverse cervical ligament. It is actually the parietal condensation of the parietal fascia covering the obturator internus, and the insertion is into the lateral vaginal wall and the supravaginal cervix. It is inserted in a fan-shaped manner. Okay, and what is the function of this McEnroth's ligament? Provides lateral stabilization to the cervix at the level of ischial spine, and it is a primary vascular conduit of the uterus and vagina. So the lateral stabilization is provided by the McEnroth's ligament or the cardinal ligament. It is also called the transverse cervical ligament. And what does broad ligament do? It is a double fold of peritoneum. Actually, broad ligament is a double fold of peritoneum. It extends from the lateral border of the uterus to the lateral pelvic wall. This broad ligament can be divided into few parts like infundibulopelvic ligament, which is also called the suspensory ligament of ovary, mesoovarium, mesosalpinx, mesometrium. Now, along with the areolar tissue, it has a steadying effect to maintain the uterus in position. So this broad ligament maintains the uterus in its position. Now, coming to Cooper's ligament, fibrous septa extending from the skin to the underlying pectoral fascia. So Cooper's ligaments are fibrous septa that extends from the skin to the pectoral fascia, and these provide support to the breast. Now, other structures in breast include areola, which is placed about the center of the breast and it's pigmented. It is about 2.5 centimeter in diameter. And Montgomery glands, they are the accessory glands located around the periphery of the areola region. And coming to the histology or mammary gland, each alveolus is lined with columnar epithelium. A network of branching longitudinal stellate cells called myoepithelial cells surround the alveoli and the smaller ducts. and behind the nipple in an area called ampulla, or the main duct dilates to form an area called ampulla where the milk is stored. These are the details of the ligaments of, certain ligaments of uterus and breast. So going into some more details, well, supports of uterus actually are by muscles, ligaments, and the surrounding structures, which in turn provides the support and prevents uterine prolapse. Now, what are the primary support or the true support? The primary supports include, first one is pelvic diaphragm. Pelvic diaphragm, which is a chief support of the uterus. It is given by levator ani muscle. It acts as a muscular hammock. You might have seen hammock in beaches, right? So this levator ani muscle acts as a hammock to the uterus, a muscular hammock, above which the uterus is placed. Okay, so it supports the uterus from the below part. Now, during childbirth, if there is a damage to this muscle, then you can expect uterine prolapse to happen. Now, the second support is uterine ligaments, which are called the true ligaments. The first one is transverse cervical ligament or cardinal ligament or McEnroe's ligament, which we have already discussed. This acts as a side anchor strap. So you have seen the support from the below area, which is the levator ani muscle, which acts as a hammock. Now from the side area, it is anchored using transverse cervical ligament or cardinal ligament. The name itself gives you an idea about the lateral positioning, right? Transverse. Now, cervix to, this is from the cervix to the pelvic wall. It extends from the cervix to the pelvic wall, and it prevents the downward displacement of the uterus, and it is the strongest ligament support to the uterus. Also, in 2025, we had a question asking about the contents of the femoral sheath or so, right? Same way, you can note down the contents in the this transverse cervical ligament also. The uterine vessels, artery, veins, nerves, and lymphatics, autonomic nerve fibers, all are contents of this portion. Now, the next ligament is uterosacral ligament. Uterosacral ligament is from the name itself, you will get it. Uterosacral, right? So which means it is from the cervix to the sacrum. Okay, every ligament would be coming from the cervix region, or it would be inserted into the cervix region. Okay, so this is from the posterolateral cervix to the anterior surface of the sacrum. Now this ligament pulls the cervix backward and maintains the uterus in the position. So this anteversion, anti-flexion of uterus, etc. are maintained by this ligament. Which ligament? Uterosacral ligament. Okay. So we have studied the support from the below, the side anchors, and from the back side, right? Now we'll have to study from the front. It must have a support in the front also, right? So that is pubocervical ligament. Now, where does this pubocervical ligament extend from? It extends from cervix, upper part of vagina, cervix to pubis, posterior surface of the pubis. Now, supports the anterior aspect of cervix. So these are the uterine ligaments. Now, going to the secondary support of uterus or the false supports. These maintain the position, but it is not as strong as the true supports, and they maintain, the first one is round ligament. Round ligament maintains the anteversion. Okay, now this pulls the uterus forward, and during pregnancy, some of them experience slight pain, the abdominal pain. It is because this round ligament keeps stretching while the tummy grows in size. So the pregnancy pain which is felt in the abdomen is due to the stretching of the round ligament. Okay. Now, from where to where? This round ligament is from the uterine cornua, that is near the fallopian tube, till labia majora, and this passes through the inguinal canal. So round ligament is a content of inguinal canal. Now, the second one in the false support is broad ligament, which is one option in the question. So this is, as said, a double fold of peritoneum from the uterus to the lateral pelvic wall. And as discussed earlier, we have seen the parts of the broad ligament. This keeps the uterus centrally placed and supports the uterine vessels. These are the functions of the broad ligament. Now, coming to the tone of the uterus, the muscle fibers, the tone of the muscle fibers also acts as a support to the uterus, a small support from that. So what is the clinical aspect? After menopause, what happens? The tone decreases and hence there is more chance of uterine prolapse. Okay. Now, the last one is surrounding viscera, right? This is the uterus is actually maintained in position with the help of the surrounding viscera also. And how does it do? Like from anterior, the bladder gives a push. From posterior, the rector gives a push, and due to the intra-abdominal pressure. So these are the supports of uterus. Now, regarding Cooper's ligament, we have told all the points. Now, moving to the fourth question. According to Sushruta, if blood is accumulated in stomach, it should be treated by. So on seeing the options, it's a two options can be neglected, right? Blood in stomach wouldn't be removed with Nasya or Shiro Virejana, right? So the left out options are Virejana and Vamana, and always Amashya, mostly it is Vamana, right? So if blood is in Amashya, then Vamana can be used or Vamana can be done. If blood is in Pakvashya, then Virejana as well as Vasti. And what is the condition for Vasti there? It is Niruham Nisneham Karyam Ushnam Vishodana. Niruham Nisneham Karyam without adding fat, and Ushnam. Ushnam means it should be given warm. Okay. And Vishodana. Vasti prepared using purgative or Virejana drugs. Now, after this, what should be given? Food prepared from Yava and Kola together with Kulata Yosha or Mamsarasa or Yavagu, added with Saindava, should be given as food. Now, if bleeding has been severe, what are we advised to do by Acharya? If bleeding is severe and the organs are punctured, then the person may drink blood. Now, question number 5. According to Kashyapa, Kshira-Lasaga Vyadhi is caused by which of the following factor in child? So, as you know, Kshira-Lasaga is a Tridosha-vitiated, Tridosha-Stanyaja Vyadhi, but that reason is said by Ashtanga Hridaya, while Kashyapa says affliction of Revati Graha, and Revati Graha affliction also causes what all other than Kshira-Lasaga? Pīdanendriya Dushanam, Nidranasha and Adinidra, Eganga Pakshavadha, Kshira Dushana, Hridaya Drava, Nasika Akshi Karna Roga, Pandu Kamala, Swarna Varna Agni Bheda. These are the other problems or other diseases caused by Revati Graha, and Tridosha Visheshan is said by Ashtanga Hridaya as a reason for Kshira-Lasaga. And treatment according to Kashyapa for Kshira-Lasaga includes Parishega with Ashwagandhadi Kashayam, Palam Kashadi Taila Abhyangam, Ashwakarna Pushpadi Kshira Kashaya Panam, Dhridapana with above said drugs, Dharana of Twak of Varuna, Arishtaka and Putranjivaka. So coming to Bala Rogas or the diseases of Bala mentioned in Kaumara Bhatya, each and every disease is very important. You will have to note down the dosha predominance. There are a lot of confusion points in those topics. Like you get confused with the dosha predominance, the specific features like Gomutra Gandhi is said in one roga, while Gomutra is used as a medicine in another roga. And somewhat, 4 to 5 rogas have a lot of synonyms, which all the synonyms you should be acquainted with, so that even if another synonym is asked in question, you should realize that this is the same disease. And the same way, the Stanya Visheshan regarding dosha and the specific modalities of the treatments, all these are very important, and you need to go through all those rogas. Now, question number 6, Mahagadam Mahavegam Agnivat Shigragaricha is described by Charaka in which of the following contexts? It is for Rekta Pitta, right? There are similar quotes like, this quote, like Mahavyadi or Vyadirantaka is said for Abasmara by Sushruta, while Abasmara is described as Gado Goram by Madhavnadana. Mahagadam is Adatwa Abhinivesham, according to Adatwa Abhinivesham, while Mahavyadi is Abasmara, and Mahamoham is Jwara. Same way, Darunam Rogam Asi Vishobhamam, that is Visarpa, while Daruna Vyadi is Ashmari, and Ashmari is also called Antaka Pratimomada Ghora Yamobama. Then Jwara is said as Sarva Roga Adipati, Sarva Praninam Pranahara, right? Shwasa has a lot of similes, a lot of descriptions like this. Kamam Pranaharascha Rogaha, Paramadurjaya, Vidyadesa Mahavyadihi. See, Mahavyadi is Abasmara according to Sushruta, while Vidyadesa Mahavyadi is Shwasam. Ghoro Bhavati Dehinam, that is Shwasam. Hada Ashi Vishaviva, it is Shwasam. Pranan Ashu Nikruntataha, that is also about Shwasa. So there are a lot of small Sanskrit shlokas regarding each disease. These are a few. You can collect others also and write it together. Now, question number 7. According to Sushruta, which one of the following is Kalantara Pranahara Marma? That is, it is immediate fatal, Tatkala Maraka, which is the Marma. It is Kshipra Marma. Okay, Kshipra is 4 in number. It is the sthana of Kshipra is Angushta Anguli Madhyam, right? And the Lakshana, what is the Lakshana of Kshipra Marma Vidha? It is Akshepa and Marana, and it is a Snayu Marma. It is actually classified as Kalantara Pranahara, but at times it becomes Sadhya Pranahara, and that is the question asked. Now, the second option or the other options given are Brihati. Brihati is also 2 in number. Brihati is 2 in number, while Kshipra is 4 in number. Okay. Now, Brihati, the sthana is opposite of Sthanamula. Lakshana of Brihati is Marana due to Rektakshaya. It is a Sira Marma, and the Vyabat Bheda is Kalantara Pranahara for Brihati. Now, coming to Simanta Marma, it is 5 in number. And the sthana is Kabala Sandhi, which is Tiriyak Urva. Lakshana is Brahma, Unmada, Manonasha, and Marana. Type of Marma is Sandhi Marma. Simandam is Sandhi Marma. And Vyabhat is Kalandara Pranahara. Now, as for Kshipra, Talahrit also has one speciality, like right in Talahrit and Kshipra, both together it is mentioned. What is it? Adi Rakta Srava cause pain by Vayu. It causes death similar to Vriksha Iva Ayudha Nipada Nikrita Mulaha. This is a simile set for both Talahrit and Kshipra. Okay, Kshipra is considered to be Sadhya Pranahara at times, though classified under Kalantara Pranahara. And when the simile is asked, it is for both Kshipra and Talahrit. Okay. Also, when you study marmas, the type of marma, the numbers, to which category it belongs, what is the, the Vidha Lakshana. So you have seen this, this headings, right? These headings, like if you study with these headings, it will be more easier for you. And in addition to this, you need to study about the Vyabhat Veda, like Kshata to Sadhya Pranahara Marma, immediate death. But Kshata near Sadhya Pranahara, it would be Kalantara Pranahara. That way, you have to study this also. Also, Anguli Pramana also should be known. And why is this Anguli Pramana important for Marma? Because during Shastra Karmas, these Marmas have to be exempted, right? So that is the reason why we need to know the Anguli Pramanas of Marmas. Now, the prognosis of Marma Vidha, like Sadhya Pranahara dies within 7 days, while Kalantara Pranahara dies within 15 days or 1 month. Now, Kshipra Marma will become Sadhya Pranahara at some times. That is the question. Vishalyagna and Vaikalyagara will be Sadhya Pranahara if severe Kshata happens. So these points are also important. While you study Marma, there is nothing to be left out. So be very sure that you cover up the 6th chapter in Sushruta Sharira completely. And I'll give you one tip. Like every time you study Marma, do not start with the Shakhagada Marma itself. Once, if you start with Shakhagada, now the second time when you revise, do start with Jatrurga. Third time, if you revise, when you revise, you need to start with another group of Marma. Fourth time, again, another group, so that you give equal importance to all the Gada Marmas. Okay. Now, question number 8. What is the regional, where is the regional office of South Central Asian region of UNICEF? Where is it? It is in Kathmandu. For the headquarters of UNICEF is in New York, while East Asia and Pacific, it is Bangkok. Europe and Central Asia, it is Geneva. Now, question number 9. According to Vagbada, which of the following is the synonyms of Ekayama? Ekayama, Jatrordum, Ruja, Tivra, Sharira, Ardhe, Adare, Abiva, Tamahur, Ardidam, Kejit, Egayama, Mathapare. That is what the Shlogam says. So, the Ekayama, according to Vagbada, is Ardidam. Now, for Apadanaka, Pakshagada, all these, there are synonyms, right? For Apadanaga, the synonyms are Dandabadanaga, Antarayama, and Bahyayama. For Pakshaghada, the synonyms are Ekangaroga and Pakshavadha. Now, coming to Antarayama, Antarayama is also called as Manyastambham by Charaka, while Antarayama is called Danushtambha by Sushruta. Bahyayama is called Danushtambha by Charaka, while Bahyayama is also called as Danushkamba or Veginam by Ashtanga Hridaya. So all these points are very important. So I'll repeat it again. Antarayamam and Bahyayamam are synonyms of Apadanagam along with Dandapadanagam. And Antarayama is also called as Manyastamba by Charaga, while Antarayamam is also called as Danushtambha by Sushruta. Okay. Now, coming to Bahyayama, Bahyayama is called Danustambha by Charaka, while Bahyayama is also called Danushkamba or Veginam by Ashtanga Hridaya. Okay, so I hope that is clear. Now, coming to the 10th question, it is again regarding the Chatusneha Prayoga, right? As I said earlier with 2025 question also, this area is very, very important, and you cannot leave any of those points in this Chatusneha indications. It's very important. Kindly do study each and every point. There are a lot of, I won't say there are a lot of confusion points, but still there are a few confusing points in this Chatusneha indications also. Like for Yoni Vishodhana, one Acharya says Taila, while another Acharya says Grita. Go find it who says what. Okay. I hope in 2025 question paper analysis, I have said these. I have discussed already these. Okay. So I'm skipping it for now. Now, the next question is from Charagam Vimanasthana, 8th chapter. This is one, yet another important topic. Like Manda, Vijjala, Acha, and Dravaguna helps in Kapha Prakriti determination. Slakshna, Mrudu, and Tikshna Guna helps in Pitta Prakriti determination. Lagu, Bahu, Vishadaguna helps in Vada Prakriti determination. Kapha Prakriti individuals cannot tolerate excessive cold. Pitta Prakriti individuals excrete excessive sweat, urine, and stool. So these are the options given, and they've asked to find out the correct answer from the options given below. So what are the correct options here? It is Lagu, Bahu, and Vishada Guna helps in Vada Prakriti determination, and Pitta Prakriti individuals excrete excessive sweat, urine, and stool. Let's see how it goes. Now, coming to Sleshma Prakriti, you can equate these gunas and the characteristic features well. Like Snigdha, Snigdhanga, Slakshna, Slakshnanga, Mridutvad, Drishti Sukham, Sugumara Avadada Gatraha. So, Sugumara Avadada Gatraha. See, Sugumara is always, considered to be very delicate people, right? In Ayurveda, for every karma, right? So Mridu, right? Mridu and Sugumara, you can have a connection with that. And Madhurya, Prabhuda Shukra Vyavaya Apatyaha. If you see the characters mentioned or the effects for, rasa related points, like in this, it is Madhurya. Coming for Pitta, you have again rasa related, Kadvamla. For Vada also there is rasa related characteristic. For all these three, the effect is related to, somehow related to Shukra and Apatya. Okay, so wherever Shukra and Apatya is asked, you might equate it to any of the rasas given. Okay, so Madhuryat Prabhuda Shukra Vyavaya Apatyaha. Now, Saratvad, Sara Samhata Stira Shariraha. Saratvad, which means Saram or Sara. What do you mean by Sara in Hindi? It is all, right? So, Sara Samhata Stira Sharira. If you have all the qualities, the Sharira would be Stira, right? So, you can connect it that way. Now, Sandratvad, Upajita Paripurna Sarvangaha. Do not confuse Sara and Sandra. They are a little bit confusing. Okay. Now, Upajita Paripurna Sarvangaha. That is Sandratvad. Mandatvad, Manda Cheshtahara Vyavaharaha. That is easy. Now, Sthaimityad, Ashigra Aramba Kshobha Vikaraha. Sthaimityam means a little bit, lagging behind, or what to say, Sthaimityam means a lethargic condition, right? Lethargic, if you correlate with it, you can get Ashigra Aramba Kshobha Vikaraha. Now, Gurutvad, Sara Adhisthita Avastita Gadayaha. So, Gurutvad, Sara Adhisthita. So, you can say that Sarvam Adhishtitam in Guru, right? You can correlate like that. Now, Shaityat Alpa Kshut Trishna Sandava Sweda Doshaha. So it is cold. What happens? So Alpa Kshut is a little bit confusing when you take it as cold. But Alpa Trishna, Alpa Sandava, Alpa Sweda, right? All these are Alpa in Shaitya. So you can correlate like that. Now, Vijjalatvad, Suslishta Sara Sandhi Bandhanaha. So, Vijjalatvad means, not much of that, how to say. So, Vijjalatvad, you can take it as no water, or, Vijjalam. If you take it like that, it is Suslishta Sara Sandhi Bandhanaha. The Sandhi are tight, or it is intact. In that way, you can connect. And Achatvat, Prasanna Darshana Ananaha, Prasanna Snigdha Varna Swarascha. So, what is this Prasanna Darshana Anana? It is good to see, right? To see, or they have good, Snigdha Varna Swara and all. So, when you see these good things, usually what do you say? Acha, right? Acha hai. So, Achatvat. Achatvat Prasanna Darshana Ananaha Prasanna Snigdha Varna Swarascha. So this is how for Kaba you can correlate. So now here for Kabha we didn't see the first statement. Manda, Vijjala, Acha and Drava is mentioned. And do you have Drava Guna in Kabha? No, right? And that is how that turned wrong. Now coming to Pitta Gunas, Ushnyat, Ushnasaha, Ushnamukhaha, Sugumara Avadada Gatraha. So there also Ushna, it's too hot. So you cannot, Ushna Asaha, you cannot tolerate. Ushnamukhaha, it's always hot. Then Sugumara Avadada Gatraha, then delicate person, right? He cannot, tolerate Ushna. Then Prabhuda Viplu Vyanga Tila Pidagaha, which means there are a lot of, what to say, black moles. Black moles occurring is because of Ushna Guna. That is what is said. So, note down that point. Now, Kshut Pipasavantaha, Ushna increases, or Ushna has, Ushna Guna gives you Kshut Pipasa, but no, it is not very high. It is like Kshut Pipasavantaha, normally. Okay, then Kshipravali Palita Khalitya Doshaha, graying of hairs, baldness, etc. increases. And Prayo Mridu Alpa Kapila Shmashru Loma Keshascha, that color discoloration of beard, hair, etc. So all these come under Ushna Guna. While for Tikshna, that is a little more easier for Tikshna Guna. Taikshnya, Tikshna Parakramaha, Tikshna Agnayaha. So these can be easily correlated. Now the next one, Prabhuda Ashana Panaha Klesha Asahishnavo. So it is Tikshna Agni, then you will have exactly Prabhuda Ashana Panaha and Klesha Asahishnavo. Now taking Klesha, if you take it as hunger, you cannot tolerate hunger, or you cannot tolerate those pains. Okay. Now, Danda Shugaha. Shuga is thorn, right? Shuga means thorn. So, Tikshna, the thorns are always Tikshna, right? So, Danda Shugaha. You can connect it that way. Now, Dravatvat, Shitila Mridu Sandhi Mamsaha. Shitila Mridu Sandhi Mamsaha. The opposite one was in Kabha, right? Vijjalatvat. So, Slishta Sara Sandhi Bandanaha. Now, here it is Dravatvat Shitila Mritu Sandhi Mamsaha. Prabhuda Srishta Sweda Mutra Purishasha. Since it is Drava, you have a lot of Sweda Mutra Purisha. Now, Visratvad. Prabhuda Pudi Kaksha Asya Shira Sharira Gandaha. So, Visratvat Gandaha. You can correlate it with that. Then, Kadvamlatvam. Alpa Shukra Vyavaya Apatyaha. So, as I said earlier, something that comes with rasa is always related to Shukra and Apatya. Okay, that is for Pitta. Now, for Vada, Vada, you have to be a little more cautious in studying, because you have a lot of, the gunas can't be very much, you don't have a lot of short points or connections to put with. Okay. So, Ruksha Apachita Alpa Shariraha, Pradada Ruksha Kshama Sanna Sakta Jarjara Swara. So, Ruksha, it is somewhat coarse or hard or something like that, right? So if you have a little bit of throat irritation, or some problem with your throat, you can say it is Ruksha Swara, right? So Jarjara Swara, Ruksha Swara, but like that you can connect. Now Jagarugascha. Jagaruga, like Jagaruga means keeping awake at night, right? What happens if you keep awake at night? Ruksha Guna increases, right? In that way you can connect Rauksha. Now, Lagutva, Lagu Chapalagadi, Cheshta Ahara Vyaharaha. Lagutva, Lagu Chapalagadi. It is lighter, and also Chapalagadi is there. And Chapala, in the sense, since it is Lagu, there's always constant movement. Okay. Chapalagadi, Cheshta Ahara Vyavaharaha. And Chalatvad, Anavastida Sandhi Akshi Bru Hanu Oshta Jihva Shiraha. Chalatwad, what is it? Chalatwad keeps on moving, right? So what all keeps on moving? Anavastidam means it keeps on moving. Anavastida Sandhi Akshi Bru Hanu Oshta Jihva Shiraha. Have you seen Vada predominant individuals? They cannot sit in a place for some time, right? They keep on moving, at least, for a while. If they are not able to stand up and walk, they'll keep on turning their heads or moving their hands. Some movements would be there always. So, Anavastida Sandhi Akshi Bru Hanu Oshta Jihva Shiraha Skanda Pani Padaha. So, all those movements. Now, Bahutva. Bahutvad Bahu Pralaba Kandhara Sira Pradanaha. So, Bahutvad Bahu Pralabam, always talking. Then Bahu Kandara Sira Pradanaha. Since Vada predominant, they would be a little lean, right? Then you can, the Kandara Sira, etc. are visible. So that's why it is said Bahutvad Bahu Pralaba Kandhara Sira Pradanaha. Now, Shigratva. Shigratvad Shigra samaramba kshova vikaraha. They're always in a hurry, right? So shigratvat, shigra samaramba kshova vigaraha. There was the opposite of this was staimityadin kabha, right? Ashigra arambam is said there. Here it is shigratvat, shigra samaramba kshova vigara. Kshova also, they get anger very easily, or they not only anger, but they show their emotions very fatafat. They do it like they don't have that control or something. It's like always very very fast. Now shigra trasa raga viragaha, they get interest, they get disinterest, everything is very very fast. Then Shrutagrahino Alpasmritayascha. That is somewhat, in that case, we are all Vata Prakriti, right? Shrutagrahino Alpasmritayascha. Whatever they hear or learn, they'll, forget that they'll forget very fast. Now, Shaityam, Shaityat, Shida Asahishnavaha. They cannot tolerate cold. Pradada Shidago Dvepaga Stambaha. Pradada Shidago Udvepaga Stambaha. They start, shivering. Pradada Shidago Udvepaga Stambaha. Also, Stamba is also there due to Shida. Now, Parushyam. Parushyam, Parusha, Kesha, Shmashru, Roma, Nakha, Dashana, Vadana, Pani, Padaha. So this is actually all the places are Parusham. That's it. Vaishadyat, Vaishadyat, Sputita Anga Avayavaha. Sputita Anga Avayavaha. What is Sputita Anga Avayava? There are cracks or something like that, right? But when cracks, etc. happen, what happens? We become, sad. What is sad in Sanskrit? Vishadam, right? So let's take this Vaishyadyam as Vishadam, so that Vaishadyat, Sfutita Anga Avayavaha, Sadada Sandhi Shabda Gaminascha. When there are cracks, you can hear sounds. So Sadada Sandhi Shabda Gaminascha. So with this, we have discussed all the three dosha's characteristic features. So make sure you study it. It is very easy. Actually, if you give a little bit of, time for this, you can go through. This is one of the most important areas in Charaga Vimanasthana. And every year you can have one question from this portion. Okay. Now coming to 12th question, Jaloga Avacharana, Prachana Karma, Siravyadana, and Shringa Alabu Prayoga. So we all know Jaloga Avacharana is Avagada Rektadushti. Prachana Karma is done in Pindi the Rektadushti. Siravyadhana is Anga Vyapaka Rektadushti, and Shringa Alabu Prayoga in Tvachistita Rektadushti. That is easy. Sushrutam Sutram. You can go and study. So this is Sushrutam Sutram, 14th chapter, a very important Shonita Varnaniyam. Do not leave any of the points in that. Now, coming to question number 30. These are the names of a few books and the authors. So with books and authors, you have nothing but, you have to study the authors, bringing in some connections. Okay. So Manorama Kandhana is by, it is a Sanskrit text titled Pranada Manorama Khandana, authored by Chakrapani. And Shabdakalpadrumam, you might have seen, you might have heard this. It is a massive Sanskrit dictionary which was compiled by Raja Radhakandadev Bahadur, a prominent scholar and reformer. Okay, now Chikilsa Kalika, it is an Ayurvedic text by Tishtacharya. He was an ancient physician with modern popular editions and translations are done by Dr. Shivashankar Tripathi. And Vachaspathyam is a comprehensive Sanskrit dictionary, again, like Shabdakalpadruma. It was compiled by Taranada Tarkavachaspati in 19th century, and it has 6 volumes. Okay, now coming to 14th question. According to Ashtanga Hridaya, Ardhida is caused due to dharana of which Vega? Ardhida is caused due to the dharana of Kshavatu Vega. In 25 question paper also, we had Vega related questions, and then also I said Vega is very important. When you study Vegas, always follow whatever you have already learned in your UG syllabus. If it is Ashtanga Hridaya, do learn Ashtanga Hridaya and also compare the points with Charaga and learn the extra points alone. Or if you are thorough with Charaga, go with Charaga and then Note down the extra points in Ashtanga Hridaya, compare them and study. That is the best way to study Vegas, and Vega is very important. You've seen one question in 25 also. Now 24 also has one question. I think 25 there are two questions, I guess, relating to Vega Dharana. Okay. Now, question 15, Ayush Swasthya Yojana launched by Ministry of Ayush contains which of the following compounds? This question also we did discuss in detail in 25 question paper. So, Ayush Swasthya Yojana, it was launched by Ministry of Ayush, and the components are it is a central sector scheme, right? Swasthya Yojana is a central sector scheme which was launched under Ministry of Ayush in the year 21-22 by merging two schemes. Okay, and it aims to integrate Ayush systems into the public health and strengthen the Ayush excellence in what all phases in education, in research, and in clinical care. So the main components are Ayush public health component, which promotes the Ayush-based preventive, promotive, and community health interventions. And it focuses on documentation of Ayush efficacy and its integration into broader public health initiatives. So main interest of Ayush and public health component is to prevent or to promote the prevention-based Ayush, through preventive and community-based health interventions, and also to document the efficacy of Ayush and its integration. It also includes a subcomponent on Ayush for sports medicine, promoting use of Ayush medicines in sports health, fitness, rehabilitation, and related services. So these all come under Ayush and public health component. Okay. Now the second is Center of Excellence. Center of Excellence component, what is it for? It supports the upgradation or the facility, the facilities are increased in the Ayush medical units in reputed institutions, both Ayush and allopathic institutions. The Ayush department facilities are increased. And it also provides financial assistance for strengthening the infrastructure and providing advanced clinical services, research, innovation, technology, introducing technology, use of those in research, etc. Okay, that is what Center of Excellence component is for. Now, so in short, Ayush Swasthya Yojana components are Ayush and public health, which includes sports medicine also, and Center of Excellence. Now, coming to question number 16, in which of the following disease Pushpakasisa Anjana is specially mentioned by Acharya Vagbhata? The answer is Pakshmashada, right? In Pakshmashada, what is Pakshmashada equated to? It is equated to madrosis. There, Pitta Kova is the main reason. And Karodi Kandum Daham Cha Pittam Pakshmantam Astitam Pakshmanam Shadanam Cha Anu Pakshmashadam Vadandi Tam. That is a shloka. So what is the importance of Pakshmashada? Kuttana is, Shastrakarma is done in Pakshmashada, right? You cannot find Kuttana in any other eye diseases. Only in Pakshmashada you will find it. So Kuttana, Jalauga and Vamana. Then Nasya is done with Madhura Shida Siddha Sarpi. And the Anjana mentioned is Pushpakasisa Anjana. Bhavana in Surasa Rasa for 10 days in Tamrapatra. That is how Pushpakasisa is made. So Bhavana is done in Surasa Rasa for how many days? For 10 days. And the Bhavana is done in Tamrapatra. Okay. Now, Lagana is chalazion, right? It is an Apaga Grandhi and it is of Kola Pramana. Bhedana is the treatment done there. And along with that, Kshara and Agnikarma is also mentioned. Now for Ajaga, it is anterior staphyloma or iris prolapse, right? Aja Purisha Tulya Grandhi is there, and it is Lohita or Lohita Pichila Ashru. It comes from that. And Ajaga is recta predominant disease, and it is Asadhya Vyadhi. Okay, so even if it is Asadhya, what can be done? That collection or the collection of Ashru can be drained out by Parshva Vidha with the Soji. And this Udaga Vistravana is done. And then Purana of Gomamsa Churna is done. After Visravana, Gomamsa Churna is, filled in, and then bandaged, and the bandage is removed on 7th day. Kshira Sarpinasya and Snehanjana is mentioned here. Okay, this treatment is mentioned by Ashtanga Hridaya. Now, Vrana Shukla was detailedly discussed in one of the questions in 2025 question paper. Vrana Shukla, it is in, Krishna Mandala, Nimagna Rupa, like Suji Vyadha, right? Suji Vidha Nimagna Rupa, and Ushna Sravana is there, pain is present, and it is also Asadhya, Rekta predominant Vyadhi. But according to Videha, Rekta, Raji, Nibha, and Vidrumabha is set for Vrana Shukla. And the Sadhya Lakshana and Asadhya Lakshana is mentioned over there. And for Kshatak Shukla, Ashtanga Hridaya, it is, according to Ashtanga Hridaya, it is Pitta predominant, right? Shada Shukla. So it is Krichra Sadhya, Kshata Shukla Lakshana is mentioned. Like in first layer, if the Kshata happens, it is Krichra Sadhya. If it is in second layer, it is Yapya. It is Suji Vidhatulya. When it is Krichra Sadhya, in the first layer, it is Pakwa Jambunibha. That was the question asked in 2025 paper, right? Yapya and Kshata Shukla Lakshana. Yapya Kshata Shukla Lakshana, it is in second layer, it is Suji Vidhatulya Vrana. And Asadhya Kshata Shukla is in third layer, Nichita Vrana is there. Okay, and that was asked in 2017. Also, we discussed the Chigilsa of this Kshata Shukla in 2025. Okay, 2025 question paper. Now, question number 17. The commonest site of carcinoma of stomach is. So, the commonest site, it is proximal part that includes cardiac and fundus part. So, actually, if you, check in Google, you might get two answers. Like pyloric antrum is also one answer, and the proximal part is also there. So previously, the common site was actually the pyloric antrum. Okay. Now in Western countries, you have increased occurrence in the proximal part, and that is why proximal part has come as the answer. They have given there's a reason also, like for proximal part, the serosa layer is lacking, and hence easy local advancement can be seen in proximal part. And while you study carcinoma of stomach, do go through the risk factors like GERD, obesity, etc., and also Virchow's node, Sister Mary Joseph nodule. All these things are related to carcinoma of stomach. Do go through these Trocheus sign. Okay, so these are to be referred. Now, question number 18. According to Sushruta, Shishirabhinandana is the Lakshana of which of the following type of Abhishanda? Shishirabhinandana is for Pittaja Abhishanda, right? While for Vadaja Abhishanda, it is Shishira Ashru, and for Kabaja Abhishanda, it is Ushnabhinandanam. So, with respect to Shalakyam, actually, it is a very much volatile subject. How much ever you study, the maximum time you remember it would be 2 to 3 weeks. Again, you'll start, forgetting things relating to the subject Shalakyam. So, make sure that you keep on revising Shalakyam again and again. That is the only way to make sure you are, familiar with the subject, at least until the exams. Okay, so keep on revising. Shalakyam, the best way to study would be, if it is, reduced number of diseases in one portion, like for Sandigada, you have only 9 diseases, right? But for Vatma, it would be 21. So it is not possible to complete Vatma in one day. So what you do, you divide it into 2 and complete 11 diseases, or, on the first day, and the rest of the disease on the second day. So the first day, if you complete Sandhi, second day Vatma 1 portion, third day Vatma second portion, then Krishna and Shukla are almost, only little, right? 5 or 6 diseases in Krishna, and Shukla also you have hardly, few diseases like 11 or something. So what you do is Krishna and Shukla can be combined for one day. So this way, keep on revising it. You need to keep on revising Shalakya 1 as well as Shalakya 2. So if you go this way, within like 2 to 3 weeks, you will have one round of Shalakyam done. I think, I mean to say both Shalakya 1 and 2. Okay, so one round would be completed within 2 to 3 weeks. Again, the fourth week you start with Shalakyam 2 or Shalakyam or any other portion which you are not much thorough with. You can start with that portion. Again, keep reading. Might be like 1 or 2 days earlier, you might be finishing the portion. Again, the third round, 1 or 2 days yet, earlier you might finish the whole portion. So with 10 days or so, you can finish Shalakam 1 and 2. So actually what happens is when you reach your exam time, it is like think how it would be if you finish the whole Shalakam 1 and 2 within a 10 days span. I don't mean that to sit and read, study Shalakam alone the whole day. No, that's not the way. Divide the time, just set in half an hour or maximum 45 minutes for Shalakam every day, so that you keep on reading, and this 45 minutes would keep on reducing. When you come for the second or third round, the 45 minutes would reduce to 30 minutes. Okay, so what happens is 3 or 4 rounds after 3 or 4 rounds of Shalakam, many portions you might not have to repeat again. It would be already in your hands. So that is the only way to study Shalakam, and if you leave it in between, it will be out of your mind. Okay. Now, question number 19. Yasya ucharam vina mutram samyak vayushcha gachati deepta agner lagu koshtasya. What is this shlogam? Can you complete this shlogam? Deepta agner lagu koshtasya stidasya udaramayaha. Stidastasya udaramayaha. What is udaramaya? It is Adisara, right? So this is the Lakshana or clinical presentation of Gada Adisara as per Madhavanidhana. So when you speak about Gada Adisara, you have Jara Moksha Lakshana, Jara Mukta Lakshana, Unmada Mukta Lakshana, right? So many Mukta Lakshanas and Moksha Lakshanas or those are available. So what should you do? You have to write all these together so that you have all in one place. Okay. Now, question number 20. Red man syndrome has been associated with rapid intravenous injection of the following. Which are the following antibiotics? The options given are clindamycin, vancomycin, piperacillin, and linezolid. So what is red man syndrome? Red man syndrome is, it is a non-allergic, rate-dependent infusion reaction. Okay, which means it is not caused due to allergic reaction, but it is caused due to the rapid intravenous injection or the increased rate of IV injection. Okay, usually the rate is, this occurs if the IV rate is greater than 10 mg per minute. At this rate, you might encounter red man syndrome, and this is usually caused due to vancomycin. Okay, and what are the reaction? Pruritus, flushing, erythematous rashes on face, neck, and upper torso. This is due to direct histamine release from the mast cells. The reaction is due to direct histamine release due to mast cells. Okay, now clindamycin is another antibiotic which is given for colon problems. Piperacillin is a parenteral antibiotic against infections. Like linezolid is a serotonin and platelet related conditions treated antibiotic. Like it is effective against gram positive bacteria, infections caused due to gram positive bacteria. Now, given below are two statements. Amla rasa has Kledana, Deepana, Chedana, Vedana, Tikshna, and Vikashi properties as per Acharya Charaka. Tikta rasa has Deepana, Pajana, Jwaragna, Lekhana, and Krimikna properties as per Charaka. So, choose the correct answer from the options below. Now, statement 1 is said to be false, while statement 2 is True. And regarding this, Charaka Sutra 26, chapter Atraya Bhadrakapiyam is one very important and, what should I say? Like, you will get questions from that chapter. That is, undoubtedly, you will get questions because even in 2025, you had almost two questions from the same chapter. Okay. Here also, in 24 also, there is a question regarding the rasa. Why? Because this portion comes under dravyam also, charagam also, right? So if you study that one chapter, a large portion of dravya guna vijnana is also covered in the same chapter. So it is, a two-way win-win situation if you study that single chapter. Okay, so do not omit it. Okay, now actions of lavana rasa, actions of amla rasa, actions of tikta rasa, all those are very important. Make sure you go through all those actions. Now, which of the following is a non-parametric test? Student t-test, f-test, Wilcoxon signed rank test, and ANOVA. So the non-parametric test among these is Wilcoxon signed rank test. So what is parametric test? Parametric test is a hypothesis test, or the test used in statistical calculation to prove a hypothesis, or to check the hypothesis. And when it is parametric test, the generalizations from the sample data can be projected or extrapolated to the parent population also, which means you derive some conclusions taking the samples, right? That is how you do the research. Once you do the research, you get some data or conclusions from the samples data, and this data can be extrapolated to the parent population also. For example, if I say, in a research to determine the prevalence of TB in a community. Okay, you have taken some sample from the total population, and you have estimated the prevalence to be some 20% or so. So when you use a parametric test, what happens? This 20% among the sample can be taken as the same. Like, it can be extrapolated as 20% in the population also. That is what the statement means. Now, what is non-parametric test? Non-parametric test is defined as a hypothesis test which is not based on underlying assumptions. That is, it does not require the population distribution to be denoted by specific parameters. You cannot extrapolate the results you get from the research. Okay, so there are a few assumptions to use parametric test and non-parametric test. Like in parametric test, what it should be, the distribution should be normal, while in non-parametric test, it is always non-normal distribution of data, and the sample size would be larger in parametric test while it is smaller in non-parametric test. So there are a few things like that. I'll just run you through a gist. Like, statistics is a science of collecting data, organizing, analyzing, and interpreting them to draw conclusions. Okay, that is clear. Now, why do you use statistics in medical field? As you know, to test the effectiveness of drugs, to compare the treatment effectiveness, to study the disease patterns, to identify the risk factors. All these are the uses of statistics in medical field. Now, this statistics, as we classify research into observational, experimental, etc., the same way that statistics types also are divided into two, like descriptive and inferential statistics. Now, what is descriptive statistics? You obtain data from the sample and you draw some conclusions. Okay, you do not intervene. You do not disturb that, the whole thing is not intervened by you, but you just collect the data and you, concise the data into single numbers. Like, you, for example, you took the HB values of 100 people. 100 is your sample size, and 100 people you took the HB. And what you do in descriptive statistics, you took this data, you found the mean, or you found the mode, or you find the median, and this 100 people's data is concised into one single value. Okay, and you describe it with these values, like it is the mean of HB values of 100 people is this, or the mode is this, or the median is this, or the proportion of anemic individuals is this much. So all these, what do? You have a lot of data which is concised into one single number or one single statistic value. Okay, so this is how descriptive statistics work. But what happens in inferential statistics? Inferential means it is used to draw conclusions, or it is used for comparisons, or it is used to draw conclusions to extrapolate it into populations. Okay, so that is for example, you compare drug and A and drug B, the effectiveness of drug A and drug B. For this, you need to use some statistical tests and do it, right? So these things come under inferential statistics. Okay. Now, what do you mean by statistical testing? Statistical testing means it helps us to decide whether an observed difference is or association, that is drug A and drug B. You have done a research and you have observed that drug A is more effective than drug B. Now, that statistical test, how do you prove it? You should prove it through numbers, right? You should prove it through values. So for that, we are using statistical tests, and this tests would confirm that the difference you have noted is actual or real and not occurred due to chance. Okay, that is what the statistical tests do, and that is called statistical testing. Now, this is based on probability theory. How do you say drug A is better than drug B? Because more cure rate or more chance means more probability of curing of a disease was found with drug A, and that is why drug A is said to be better than drug B. So this is purely based on probability testing or probability theory. Okay. Now, the steps in statistical testing have been discussed in 2025 question paper. There was a question the order of statistical testing or hypothesis, right? So you have to state the null and alternate hypothesis, then you have to find the level of significance. You should determine the level of significance. What do you mean by level of significance? Level of significance means, so if you in any condition where you collect data, or you what to say okay, you say that you cannot say 100% HB will be reduced. In 100% of cases, HB would be reduced in primi gravida. Is that statement correct? No, right? You have some exceptions. You will have. So one experiment, or you check one primi for HB, might be less. Second one might be less. Third one might not be that less. Fourth one might be again less. So this way, if you check 100 people, maybe 90 of them or 95 of them or 99 of them will have lesser, HB, while some of them, a few of them would have normal or above normal HB, right? So always you cannot make sure that you get 100% probability. So there is some percentage of error or some percentage of difference that is sure to happen. Okay, some percentage of error. So very frankly speaking, you do an experiment and you cannot say that if you repeat this experiment, or if you do the same research again, if you repeat it in 100 people or 200 people or any number of people, any number of samples, 100% you will get this same result. This is not possible, right? You cannot say that. So I am sure that 95% you will get the same, but there is a chance of error of 5%. That is how we will be saying, right? And that 5% is called the level of significance. So maximum in any research which we do, 5% is kept as the chance of error. So simply speaking, level of significance means the chance of error that can happen. So that is kept as 5%, and that is decided by the researcher himself. the person who is going to do the research will decide that my research might have a chance of 5% error. So 95% I will be confident about my result, while 5% chances of error are still present. So this 5% error is called the level of significance, while the 95% is called the confidence interval. Okay. Now you have to, the second step is to, decide the level of significance. And this is, the notation of level of significance is alpha, which is kept as 5%. Okay. So the first step was stating null and alternate hypothesis. The second step was to determine the level of significance. The third step, what do you do after determining the level of significance? You need to determine what statistical test you're going to adopt. So in order to decide the test, what all things you should know? Every data cannot be calculated or cannot be, cannot be calculated by every single test, right? Each test might be applicable only to certain kind of data. So the type of data is very important. Qualitative data can be assessed by some of the tests, while quantitative data can be assessed by some other tests. So the type of data is very important. And the second thing is what kind of distribution the data undergoes. So you might have heard about normal distribution, right? Normal distribution is what mostly you people hear when you come to PG. Now, then you will hear other types of distribution also. Now, for now, do understand what is normal distribution. Normal distribution means, you have n number of sample values, like say for example 100 sample values you have with you, and among these 100 values, most of the values would be towards or near to the mean value of this 100. That is what normal distribution says. So when you plot a graph, what happens when you keep plotting the points? After plotting, you will see an inverted bell-shaped graph for your data, if it is normal distribution. Because what happens, the peak of the bell, that is a little broader, and it comes to, it merges to one point, right? So there will be one point where it is denoted out, it is taken as a mean, and most of the most of the values would be nearer to the mean or the central value. Only a few values would be scattered to the maximum and minimum levels. Okay, so that kind of distribution is called normal distribution, and if you plot it, you will get an inverted bell-shaped curve. So if it is normal distribution or not, that is also one criteria to select the test. Then how many groups you're testing? If it is one group, are you testing the group or one sample group with the non-population value, or you're testing between two groups, or you're taking two or more groups? All these, decide the type of statistical test you have to take. Now, if it is a paired data or an unpaired data, that also matters. Paired data means one single sample set, and you are taking the before and after values of the same population. That becomes the paired data. Unpaired data means you take the values of two different groups or two independent groups. That becomes the unpaired data. So depending on all these, you can decide what statistical test you will be adopting. That is the third step. Okay. Now, fourth step, after deciding the test, what will you do? You'll collect all the data, and calculations will be done, and the test statistics will be found out. What is statistic? Statistic means the sample values that you generate from the tests. Okay, those values are termed as statistic. Okay. Now, if it is for the population, for the entire population, the values are termed as parameters, while for the samples, that values are termed as statistic. So sample mean is a statistic, while population mean is a parameter. Now, I think you know the difference. Okay, so according to the test, you might calculate the Z value or the T value or the F value or the chi-square value, whatever it is. According to the test, you will be calculating the test statistic, and then you will obtain the P value. P value means this, how far your results are statistically significant. That is, told by the P value. Okay, so generally, if the p value is less than 0.05, then the test is statistically significant and you will be rejecting the null hypothesis. What does null hypothesis say? It says that there is no relation or there is no association or there is no effect. That is what null hypothesis say, right? If you're trying to prove that this drug is effective in this condition, your null hypothesis would be this drug is not effective in this condition, right? And your alternate hypothesis would be this drug is effective in this condition. Okay, and that is what you're trying to prove. So always in the case of research, what we do is we either try to prove null hypothesis true or we try to reject the null hypothesis, proving it false. Automatically, what happens? The alternate hypothesis becomes either true or false. Okay, so always what we consider is about the null hypothesis as far as research is concerned. So what happens? P value is less than 0.05, then it means the result is statistically significant and hence my research is valid, or my null hypothesis is not true, so I'm rejecting it. If the p value is greater than 0.05, then what happens? My research is not that statistically significant, so the null hypothesis must be accepted. What do you mean by p value less than 0.05 or p value greater than 0.05? Do you remember level of significance? I said 5%, right? That is what usually the research, usually our medical researchers have the level of significance as 5%. So p value less than 0.05, which means 5% means 5 by 100, which is 0.05. So the p value is less than 0.05 means the chance of error in my research is less than 5%, which means I am 95% or more than 95% confident that the result obtained is true and not by chance, right? Which means my p-value is less than 0.05. So that my result is statistically significant. And hence, what can I do? I can reject my null hypothesis. Okay. So if my p-value is greater than 0.05, what does it mean? It means that my level of significance is more than 5%, which means the chance of error is more than 5%. If it is more than 5%, so my confidence interval, or I am not 95% confident about my result. I am less than 95% confident that my result was actually real. More than 5%, it occurred by chance. So what do? We accept the null hypothesis. Got it? The difference? Okay. Now, these tests are, the statistical tests are classified into two, parametric and non-parametric. That is what this, question is about. So what is parametric test? As I told you, statistical tests that assume the data follows normal distribution. Now you know what is normal distribution. So when parametric tests are concerned, we assume that the data follows a normal distribution, which means most of the sample data lies nearer to the central value or the mean. Okay. And they are based on the parameters like mean, or mean and standard deviation. And what do you mean by standard deviation? Standard deviation means the level of difference or the amount of difference that each sample value has from the mean value. Got it? Each sample value might differ from the mean value, right? For example, if you take 5 values like, 1, 2, 3, 4, and 5. Okay. Finding the mean of this 1, 2, 3, 3 plus 3, 6, 6 plus 4, 10, 15, 15 by 5. So the mean value is 3. Okay. Now, when it is normal distribution, what do you say? This all these values are very near to the mean value. Now, each of these value do differ from the mean value, right? 1 differs from 3, 2 differs from 3, 4 differs from 3, 5 differs from 3, right? All these differences are called the standard deviation. Okay, this is a general, statement, to make you understand what is standard deviation. Okay, so the amount of difference of each value from this mean value of the sample is called the standard deviation. So these parametric tests are based on the mean values and the standard deviation. Okay, and another condition of parametric test to be used is the observations must be independent. Independent observations means you observations are the data values, individual data values you collect from the samples. Okay, so for example, if you take the HB level of 100 patients, patient A gives you a HB value, patient B gives you another HB value. These two values are not interdependent, right? Irrespective of patient A's HB level, patient B's HB level can be anything. It is not dependent. They are independent values. So the data should be independent. Okay, now these conditions should be fulfilled to use parametric tests. And when you use these parametric tests, what you can make sure, you can be sure that you can extrapolate the results to a population. Okay, now what is about non-parametric tests? Just opposite of these parametric tests. All the opposite. It does not assume that the data follows normal distribution. The sample size is very less. While in parametric tests, usually the sample sizes are very large. Okay, only large sample sizes give you normal distribution. Okay, because why do I say that? Just imagine there are 5 samples. Okay, and I'm 5 people. I'm sending them into a room, into a large room. Okay, so 100 square feet room. I'm putting in 5 people. So there are place between the space between them, right? They are scattered here and there. But in the same time, if I put 100 people into this 100 square feet area, what happens? Most of them are standing together, right? So the scattering of the population is, or the scattering of the samples is less. So what happens? Most of the people are towards the and more near to the center value. And what happens if most of the people are near to the center value? When you plot a graph, it becomes normal distribution. Okay, this is how it goes. So the sample size should be more to give a normal distribution, and that is a parametric test. While in non-parametric test, what happens? The sample size might be very low because they are not normal, right? They are not normally distributed. They are scattered. Okay. Now, this parametric tests were based on mean and standard deviation, right? While non-parametric tests are based on ranks or medians and not means. Okay. So these are the general differences between parametric and non-parametric data. Okay, now commonly used tests in non-parametric, that is non-parametric data, for non-parametric data are chi-square test, Fisher's exact test, McNemer test, Wilcoxon's sign test, and Mann-Whitney U test. So commonly used parametric tests are Z test, Student's T test, F test, and ANOVA test. Okay. Now coming to parametric tests. The first one is Z test. Z test, the points to be noted are sample size is greater than or equal to 30. Okay, the sample size will be greater than or equal to 30. And the standard deviation of the population is none here. So usually what happens, the population mean or the population values, population parameters are not, many of the times. Like, for example, if we are determining something related to hemoglobin level, okay, can you, determine the value of hemoglobin, mean value of hemoglobin, the entire world? The entire world is the population, right? The entire humankind. If you are just determining the, what to say, average value of hemoglobin level. So the sample will be particular people selected, but the population is the whole entire, or to be very precise, let me say the prevalence of anemia in first trimester woman. Okay. Now, for the sample, you may determine, but can you determine the prevalence of or the percentage of or the mean value of hemoglobin in the population as such? No, right? It is not possible. So, in most of the cases, population parameters regarding medical research is unknown. Okay. Now, for EZ test, what happens is there are certain conditions where the population parameters are known. Okay. So in EZ test, the population standard deviation would be known. Now, this uses normal distribution. As we know, it is a parametric test. So normal distribution is there. Then sample mean is compared to population mean. So that is what is done here. Since we know the population mean or population standard deviation, the sample mean is compared to the population mean in EZ test. So when do you use an EZ test? The sample should be greater than or equal to 30, and you should know the population standard deviation, and you have one sample group for which you have determined the mean value, and now you're comparing it to the population mean. This is where the EZ test is used. Okay, so for example, mean HB of 150 pregnant woman is compared to the national, mean HB. We have determined national mean HB, right? So those, mean values or the general values determined. With that, we can combine, or we can compare the mean HB of 150 pregnant woman. Okay, that is an example. Now going to students' t-test. Student t-test is almost the same as z-test, but the difference is that the sample size is less than 30. It compares the means or averages of two groups and checks if the difference is real. There are two groups. You calculate the means of two groups, and these means are compared and analyzed to know if the difference is actually real. And the sample size in t-test is always less than 30. And usually for our researchers, researchers in PG level, mostly t-test is used. Okay. And here, population standard deviation is unknown. That is another difference from z-test. Population standard deviation is unknown in t-test, while it is known in z-test. Now, data is numerical data, and it is a normally distributed data in t-test. Now, this t-test can be of three types. It can be independent or unpaired t-test. It can be paired t-test, or it can be one sample t-test. Now, what do you mean by independent t-test or unpaired t-test? As I told you earlier, independent, right? So, two different groups are compared. So, for example, HP level in vegetarians and non-vegetarians. So, there are two groups, vegetarian group and non-vegetarian group, and then you're comparing the HB means of these two groups. So, that is an example of independent t-test, okay, or unpaired t-test. Now, paired t-test. Paired t-test means you analyze a group of people before an intervention, then you give the intervention, and then later on you analyze the values again for the same group of people. Okay, so comparing the before and after means of the same group. For example, mean sugar value. You have taken the mean sugar value before giving an intervention. Now you give the intervention. Later on, after the particular period, you again check the mean sugar value of the same population, and you compare these two means. That is what happens in paired t-test. Now, what is one sample t-test? One sample t-test means you have only one sample. You take the mean of that sample and you compare it to the population value. You compare the population mean. Okay. So, for example, the mean birth weight of neonates in a hospital is compared to the standard birth weight determined by WHO. Okay, so that is an example of one sample t-test. Now moving to the F-test. What is F-test? F-test compares the variances of two groups. Okay, so variance means the as it is as same as standard deviation. It says, or it denotes the variation between the samples and the sample mean. Okay, but the thing is, variation is just the square of standard deviation. So for calculation purpose, it is always easier to use standard deviation rather than variance. And standard deviation, you get the values similar to the actual data collected. Like if you collect, BP, the BP standard deviation would be like 5 mm of Hg, which is very much comparable to the values. BP, you take in mm of Hg, the same way standard deviation also you'll be getting in the same units. So the comparability is very good in terms of standard deviation. Variance is not that comfortable for calculations, but variance is the same as standard deviation. Okay, it is a square. So it determines, the F test determines how far the data is spread or scattered in the group. Okay, that is what F test analyzes. So it checks the variability. For example, if you take the BP levels in a group of young age and a group of adult age. Okay, so if you do F test, you can find out the variation of BP among the young age and the variation of BP in the adult age, and you can compare those variances. Okay, so in between, among the people in young age group, what is the variation of BP, and among adult age, what is the variation? These two can be calculated, and then these variances can be compared using F tests. I hope it is clear. Now, ANOVA test. ANOVA means analysis of variance. It is, it uses F test to compare the analysis or analyze the variances of two or more groups. That is what ANOVA does. So if you have more than two groups, it is not two or more groups, sorry, three or more groups. Okay, so if you have more than three groups, so till two group, you can use independent t-test, you can use other tests, like possibly independent t-test can be used for two groups. But when it comes to three or more than three groups, you cannot keep on using multiple t-tests. What happens? The chance of error keeps increasing every time you do the test, right? Because level of significance is always kept at 5% at least, right? So every time you do a t-test, what happens? The level of significance adds on to 5%, right? So what happens? The chance of error is increasing. So instead of that, what you can do is you can do an ANOVA. When you have three or more than three groups, an ANOVA test can be performed so that the chance of error is minimized. Okay, now comparing the mean values of HB among first trimester, second trimester, and third trimester women. So you have three groups, or you can compare it with first trimester, second trimester, third trimester, and Sutika. So you have four groups. So in that cases, the best test to be used is ANOVA. Okay, so I hope parametric tests are clear. Now, ANOVA also is like one-way ANOVA and two-way ANOVA, mainly one-way. There are yet other classifications also, other types also for ANOVA, but very simply, the basic classification is one-way ANOVA and two-way ANOVA. One-way ANOVA means you check for one variability or one variable. Okay, for example, you check for only HB levels. But two-way ANOVA, you check more than one variable. Like you check for HB variability along with the gender. It's not gender. Along with age. It might be along with age. Okay. So that way, you consider two variables for analysis. That is two-way ANOVA. Now, coming to non-parametric, I've already told you what is non-parametric test. Now, coming to the most, commonly used non-parametric tests, like one is chi-square test. So for chi-square test, it is like to check if there is an association between two categoric variables. Chi-square test is used. Okay, categoric variables. Categoric variables means the variables or the data that can be categorically arranged, but not numerically arranged, right? They are, put into categories like male, female, or smokers, non-smokers, diabetic, non-diabetic. That way you can categorize the data or the samples into what different categories or different groups based on the quality and not the quantity. Okay, so such categorical variables, in such categorical data, to analyze the association between the two categorical variables, you can use chi-square test. Mostly this categorical variables or categorical data are used or made use in study designs like cross-sectional, case control, cohort studies, etc., right, to find the association and all. So in these studies, mostly chi-square test is used. Okay. To tell you an example, this test analyzes whether the observed value is compared to the expected value. That is what the test does. So, for example, in a case scenario, like you have two groups, like anemic group and a non-anemic group. There are males and females in both the groups. Okay, so if you put on the data, there are males who are anemic and males who are non-anemic. Let's say males anemic is 30 and males non-anemic is 70. Okay, a total of 100 males. Now in females, female anemic percentage or female anemic number is 70 and female non-anemic is 30. That is also total of 100. So 100 males and 100 female samples, and you have categorized them according to anemic and non-anemic category, and they are males and females. Okay. Now, what happens? You have to analyze if anemia has some relation with the gender. Okay, so this kind of analysis is done with chi-square test. Hope I am clear now. Now, here in chi-square, there are two, words, two phrases you have to be in, you have to be aware of. Like test of independence. Test of independence means it checks the association between two variables. Okay, one is test of independence, and then another one is test of goodness of fit. Test of goodness of fit, which means it checks whether the observed data fits the expected distribution. So we have an expected, conclusion, and if the observed data fits into the expected, conclusion or expected distribution. That is what is checked in chi-square test. So that is how one is test of independence and the other one is test of goodness of fit. These two are checked. Okay, now the second one is Fisher's exact test. Fisher's exact test. It is actually same as chi-square test, but is used when the sample size is very, very small. Okay, generally non-parametric, the sample size would be small, and Fisher's exact test is used when the sample size is very, very small. Okay, but the other things are, that is checking the relation between two categoric variables. That is same as chi-square test itself. So for example, association between the mode of delivery and postpartum infection. So why is this example set? Like postpartum infection is a rare occurrence. You cannot have a postpartum occurrence in every single delivery, right? So that itself is a rare occurrence. So the sample size will be very limited. And now you're analyzing the relation between the mode of delivery and the postpartum infection. So the obviously the sample size would be very low. And in this case, in such cases, Fisher's exact test would be used. Now, McNemar test. McNemar test means the same subject are measured twice. Does a bell ring, regarding a similar test in parametric? So, same subjects are measured twice, just like pair t-test, right? So, but here the outcome is categorical. That is, you get an yes or no. I'll detail it then you'll with an example so that you will get it. So in case of dysmenorrhea, okay, what happens? There are a group of sample people, a 50 number of people you have selected, patients with dysmenorrhea. You're giving before your intervention, you're taking the dysmenorrhea pain scores. Now you give your intervention, and then later on, after say for a period of 3 cycles or 4 cycles or 6 cycles, you're again analyzing the same group of people. And what happens? There may be people who have, the level of pain score might have reduced, or, people might have got completely cured from dysmenorrhea, right? There will be changes. So, now what do you compare in this with McNemer test? How many people have moved from this yes category to the no category? That is dysmenorrhea positive to dysmenorrhea negative. So this is what is calculated by McNemer test. Okay. Now coming to Wilcoxon test, it is same subjects are tested again or twice, before and after, but here the pain score difference is calculated, or the pain score is analyzed. Okay, like for example, people with pain, you analyze the pain score and you give some intervention or a physiotherapy or something like that, and then you analyze the pain score after the treatment. So here, this is same person, how much change has happened. That is what is taken in Wilcoxon scientist. Okay, now I think you're clear between McNemer and Wilcoxon. Now, Mann-Whitney U test. This is another test, non-parametric test. It compares two different groups. Compares between two different groups. Like, for example, there is a group pregnant ladies, a group of 10 pregnant ladies in group A, and group of another 10 pregnant ladies in group B. And for group A, you're giving epidural, and group B, you're not giving epidural. Okay, so epidural group and non-epidural group. And now you're analyzing the pain scores between these two groups. So that is done by Mann-Whitney U test. So these are the non-parametric, commonly used non-parametric tests. I think by this, you're almost clear about the parametric and non-parametric tests, which are the common ones used. Do study the, common points, very very important points of each test, and for how many groups to use this test, for what is the sample size, whether it is a parametric or non-parametric tests, and whether it is compared with the population mean or population parametric, or whether it is compared between the groups. All these points should be studied. Okay, now moving on to the question 23. So this, it is better to note down the formulas also, because in 2025, there was one formula related to regression analysis, right? So I am sure that it is impossible for you to mug up all these formulas. It's not possible practically without knowing what it is, but still just have a picture memory of these formulas. Okay. Now, question number 23, match the list according to Sushruta. So, individual Prameha Kashayas are given. So, that's one important, topic. In as far as 2024 question paper is concerned, Prameha was a star disease. You have almost 4 questions from Prameha Chikitsa. Okay, so this is the one question which has come from the individual Kashaya Yugas for individual Pramehas. Okay, now 24. According to Charaga, Anupakramya is said in the context of, it is Shanda. Yeah, that is, it is Shanda. So, Charaga, Bija Dosha to Garbhasta Maruta Upaharashaya Nridveshanya Astani Chaiva Shandi Syad Anupakrama is said for Shandi. Okay, so Shruta says Anartava Astana Shandi Karasparshacha Maidune. So these, Karasparshacha Maidune, Anartava Astani, Nradveshanyastani, all these are very important. Okay, for Ashtanga Hridaya also, Bija Doshata is said, also Nradveshanya Astani is also said for Shandi. So other yoni rogas are also to be studied, and for yoni rogas, when you study, do go through such kind of things like Vadigi Miva Dukhitam, Shadahat Saptaratradva, Artavesa Vimuktetu Takshanam Labade Sugam. These one-liners or these part of shlokas can be given and asked which yoni roga is that. And also the treatment aspect is also very important. But when you study yoni roga, make sure you study the types and the features of yoni roga first, and then move on to the treatment. Okay. Now, question number 20, Yoni Roga is very important. It is a 5-star topic, and you will get a question from Yoni Roga undoubtedly. So please do not omit it. And question number 25, according to Charaga, what are the therapeutic recommendations for the management of Taruna Jwara? So, Navajwara, you know, Langanam, Svedanam, Kalu, Yavagwa, Stiktako, Rasaha, Pajanani, Apakwana, Avipakwanam, Doshanam, Tarune, Jware. That is a shloka. So, accordingly, you can choose the option. Actually, this question was dropped because every single option has some or the other wrong, option mentioned. Okay. Then question number 26, which of the following causes hindrance to attain success in yoga according to Hada Yoga Pradipika? So Janasanga Parityaga is said as, a method to attain success. So here the option is Janasanga, which is the answer. Okay, Sahasa, Utsaha, Dairya, Tattva Jnana, Nishchayam, Janasanga Parityaga are the Yoga Siddhikara Bhavas. Okay. Now, question number 27. When you study yoga, do not completely ignore yoga. You can, go through a few important points. Selectively, if you're a person who is not interested in studying yoga or you don't have time to study yoga, for that matter, whichever, portion, I wouldn't recommend you avoiding any one particular topic completely, because in 2025 we have seen that questions have randomly come from every other part of the portion, right? So you cannot say this one is only important, this is not unimportant. No, you can say this is important, but you cannot avoid any of the portions saying it is unimportant. Okay, that is the case scenario now with AAPGT examinations. So my suggestion would be, please go through the 3-star areas at least with such portions like yoga, padartha, and bhava prakasha, bhela samhita. All these do go through at least the 3-star points. Okay. For people who are aiming for higher ranks, nice ranks, all India institutes and all, I won't say go through only 3-star points. You will have to go through every single point in your notes. Okay. Now, question number 27. According to Charaga, what are the clinical manifestations of Jwara Moksha? See, we had Gada Disara Lakshana as one question, right? Now, the next question from Jwara Moksha. When I said about Gada Disara, I already mentioned, do write the Jwara Moksha, Jwara Mukta, Unmada Mukta Lakshanas together, right? If you write this, if you have had this in one sheet, these two questions could have been answered easily, right? Because a probability of you taking Jwara and Unmada and Adisara and learning these is far more less than the probability of you taking one single sheet of paper with these 3 portions inside it, right? So please do write it together and then study. Okay, Jwara Moksha and Mukta are very much, familiar with all of us. So I'm not going to go deep into it. It is also there in your notes. Now, question number 28. Which of the following statements are correct? Charaga has mentioned 19 Phalani Dravyas. Yes, it is right. As per Charaga, root of Aparajita is used for Shiro Virejna. That is also right. Now, Basma is not included in Audbidagana. Kshara, Kshira, Bhasma, etc. are included in Audbidagana by Charaga. So that is wrong. Now, latex of Snuhi or Snuhi Kshira is used for both Vamana and Virejna. No, Snuhi Kshira is used for Virejna, while Arka Kshira is used for both Vamana and Virejna. Now, as per Charaga, Kadurasa increases Visha. Is it the Kadurasa that increases Visha? No, it is Lavana Rasa that increases Visha. Okay, so A and B are only the correct answers, but the option was not there in the question and the question got dropped. Okay, so go through the Charaga Sutra. Well, you have options given from different, contexts, like in one question. Okay. So question number 29, match Parada Samskara with their respective effects on Parada benefits of Phala or therapeutic benefits after processing as per Rasratna Samuchaya. The order of the Parada Samskara is very important. In this question paper itself, there are two questions related to the same portion. This same portion, one is this, and the other one is related to the order of the samskaras. So when you come to the Ashta Samskara, the names, the order of the procedures, the properties obtained with the procedures as a result of the procedure, and the process. The process comes to the last part, while the names, the order, and the properties belong to the very core region of this. Okay. Now, 30th question, Benedict's test, Rothera's test, Harrison's test, and Schlesinger's test. So Benedict's test, it determines the glucose level or reducing sugars in urine. The principle behind it is the glucose reduces the cupric ions in Benedict solution to cuprous ions, producing characteristic colors. Like if it is green, it is the lowest sugar concentration, while yellow is a little more higher, orange is again a little more higher, and brick red precipitate is the highest sugar concentration. Okay, now the clinical use of this test is in diabetes mellitus and glycosuria. It is used to test the simple carbohydrates to detect the reducing sugars which have free ketone or aldehyde functional groups. So the test is done with urine, and it detects the glucose or the reducing sugars and the color change. These are important. And the cupric ions to cuprous ions, that point. Okay. Now, Rothera's test, it detects the ketone bodies in the urine. So ketone bodies do react with the sodium nitroprusside in the solution in an alkaline medium to give a purple-violet ring at the liquid interface when the sodium nitroprusside, ammonium sulfate, and ammonia are added to the sample. Okay, to the sample, sodium nitroprusside, ammonium sulfate, and ammonia are added, and it gives a purple or violet ring at the liquid interface. This is, Rothera's test, and it detects the ketone bodies. And the clinical use is in diabetic ketoacidosis, starvation, vomiting, etc., where ketone bodies are produced in the body. Now, Harrison's test, it determines the urobilin in urine using barium chloride strips. Okay, with Fauchet's reagent. So what happens is the urobilinogen is oxidized to urobilin, giving it a greenish fluorescence color. Okay, so the clinical use of this is wherever urobilin is found in urine, right? It is hemolytic jaundice and liver disorders. Now, Schlesinger's test is also used to detect bile pigments, that is specifically bilirubin in urine. It uses zinc acetate and alcohol to form again a greenish fluorescent color under UV light. Okay, here also the principle is oxidation, but the oxidation of bilirubin to green color, biliverdin, producing this green fluorescent color. And the clinical use is obstructive and hepatocellular jaundice. Now, question number 31. According to Sushruta, Kshetra Jnanam Adhishtanam is Mana Buddhi Avyakta Vyakta. It is Sarva Bhudanam Karanam Akaranam Sattva Rajastamo Lakshanam Ashtarubam Akhilasya Jagadaha Sambhava Hedur Avyaktam Tadegam Bahunam Kshetra Jnanam Adhishtanam Samudra Iva Udaganam Bhavanam. It is set for Avyakta, right? It is a direct question. Now, according to Sushruta, Shadharana Yoga is indicated for Amashe Gada Vada. It is indicated for 7 days, and the Anupana is Sudhambu. So Gadavada is important. In 2025 also we acquainted with 2 questions from Gadavada, I guess. So here also there is yet another question. Again, one more question is coming from the same portion in the same question paper. So I do not have to repeat, I guess. You have to study the entire Gadavada. It is very important in Vadavyadi. Okay. Now question number 33. Eladigana, Aragvadadi Kashaya, Asanadigana, and Valsagadigana. Yet another question from Prameha. And the use of these ganas are actually asked as a match the following. So we know Vranarupana, Eladigana, Udvartana or Udvartana is mentioned as Utsadana by Sushruta, and the drug mentioned is Aragvadadigana Kashaya, while Parisheka is done by Asanadigana for Ashtanga Hridaya and Salasaradi for Sushruta. Pana Anna Samskarana is done by Vatsagadi in Ashtanga Hridaya and Pipalyadi in Sushruta. Now, question number 34, Valsanaba. This is, drug and its chemical constituents given. So, Valsanaba, it is aconitum ferox, right? So, aconitin is the chemical constituent. Well, Pida Caravira, it is Tavasian. And Gunja, it is Abrus precatorius, so it is Abrin. Ahifena, it is Papaver somniferum morphin. Okay. So, see, Ahifena, Papaver somniferum, Papaver acea, and the chemical constituents are morphin, codeine, narcotin, and papaverin. The synonyms like Thila, Beda, Kashtila, and Afugam, etc. are given for Ahifena. Like Valsanaba, it is Aconitum napellus or Aconitum ferox. Ranunculaceae is the family. Aconitin, Napellon, pseudoaconitin, etc. are the chemical constituents mentioned for Valsanaba. And the synonyms are Amrita, Visha, Kshveda, Garala, Visha, etc. Okay. Gunja, Abrus precatorius, Fabaceae family, Abrin, Abrol, Precol, etc. are the chemical constituents. Synonym, Chudamani, Kakanantika, Krishnela, etc. Then Pida Caravira, it is Tavassia neerifolia or yellow oleander, while Caravira is called Nerium indicum or Indian oleander. Okay, Pida Caravira is Tavassia neerifolia. They belong to Apocynaceae family. The chemical constituents are Tavasian, neerifol, and ruboside. Chemical constituents, mostly, if you know the scientific names, few are very much relatable to the scientific name itself. So, whenever you study a drug from Dravyam 2, do make sure that you study the botanical name, the scientific name, the part used, the family, the botanical or scientific name, the part used, the common name, the family they belong to, certain very important commonly used synonyms, the chemical constituents. These points should be there for every single drug, and for certain drugs there are a few standout points. Those are also to be studied. Okay. Otherwise, you cannot keep studying all the synonyms, all the chemical constituents. That's not practically possible. Right. So make an idea that, the most common synonyms, the most common chemical constituents in the drugs. Now, given below are two statements. When chlorine is added to water, hydrochloric acid and hypochlorous acid are formed. The disinfection action of chlorine in water is mainly due to hypochlorous acid. So, both the statements are correct. And when you dissolve chlorine in water, you get hypochlorous acid and hydrochloric acid. The disinfecting action of chlorine in water due to the formation of hypochlorous acid, and chlorine has a residual germicidal effect. And the recommended contact period is 1 hour, right? For residue to have the free residual chlorine in water. Contact period of free residual chlorine in water is 1 hour. And Horrocks apparatus is used to determine the chlorine demand of the particular sample of water. Tests for chlorination include orthotoluidine, that is OT test, or orthotoluidine arsenite, OTA test. Okay. Question number 36, as per Charaga, which of the following dravya is not included in Prajasthabana Gana? Shiva, Avyatha, Shatavirya, and Durva. These are the options given. Durva is the answer. But in Garbhasthabana, Aindri, Brahmi, Shatavirya, Sahasravirya, Amokha, Avyatha, Shiva, Arishta, Bhatya Pushpi, and Vishwaksena Kanta are the 10 drugs mentioned in Garbhasthavana Gana, while Shatavirya and Sahasravirya are said to be known as Durva Dvayam in commentaries. Okay, but Durva is not as such given in the list. Maybe that is the reason why Durva was the answer. Okay, the mode of usage is wearing it on the shiras or in the right hand, or Payasarpishova Panam and Pushe Snanam. These were the mode of usage. So, Aindri is Goraksha Karkadi. Well, Shatavirya and Sahasravirya are known as Durvadvayam. Amokha is known as Padala. Amokha is otherwise Padala. Avyatha means Guduji. Arishta means Kadurohini. Vatya Pushpi means Pida Bala. And Vishwaksena Ganta is Priyangu. Okay, and in addition to this, Jivaniya Aushadas are said to be used, can be used frequently for all purposes. And also, Chakrapani, when he defines this, he has defined the define the word garbhasthavana, what it means. Garbhasthavana means the samprati sthithasya garbhasya garbo ubhaghataga bhava prabhava bhava prabhavagnagatvena yad punah sthitikaragam, the the thing which nullifies the effect of garbhopagadagara bhava and garbha punasthitikaragam. That is called garbhasthabana. That is protecting fetus by all means from the garbhopagadaka bhava and retaining the fetus. That is called garbhasthabana, and the drugs used are these 10. Now, question number 37. What are the reasons for the lagu guna of goat milk? So, on seeing the options, see, it does more physical activity, it consumes more water, it eats kadu tikta rasa predominant feeds, and goat consumes less quantity of water. So, when you see the options itself, you can decide one thing. Either the second option would be B option would be correct, or D option would be correct. Both cannot come together, right? It consumes more water and goat consumes less quantity of water cannot be an option together. Okay, now, so any option which says B and D together would be wrong. So the first option says B and D only, that is wrong. Okay, either B or D would be the answer. Now, if you do not know the concept completely, okay, you have not studied about the gunas of goat milk, in that case, just see, it consumes more water. Water or up has guru guna, right? Here the answer, the question asked is lagu guna of goat milk. So do you think consuming more water would be a reason for the milk to be lagu? No, there are less chances, right? So there are more probability that goat consumes less quantity of water can be the answer, right? So D, the option which has D in its list would be the answer. So we have omitted one. So B option can also be omitted, right? Consumes more water. So the second option can also be omitted. Now 4 has reduced to 2. Now you have 50-50 chances, right? It can be either 3 or 4. So here the option 3 is the correct answer. It does more physical activity. It eats kadu tikta rasa predominant feeds and it consumes less quantity of water. So as far as Sushruta is concerned, ajanam alpakayatvat kadu tikta nishevanat na atyambupanat vyayamat sarva vyadiharam payaha. These are the 4 reasons said by Sushruta. Alpakayatvat kadu tikta nishevanat na atyambupanat vyayamat. Okay. Now Ashtanga Hridaya has mentioned, Ashanair Lagu. Kadu Tikta is the rasa mentioned by Ashtanga Hridaya also. He also has mentioned Alpa, Ambupanam, Vyayamam, etc. Extra is Ashanair Lagu, and also a few diseases he has enlisted like Shosha, Jwara, Shwasa, Rekta, Pitta, Adisarajit. Okay. Now coming to Charaga, he has a difference of opinion in the rasa. Kadu Tikta was the rasa told by Sushruta and Ashtanga Hridaya, while Charaga says Kashaya Madhuram, and it is Sheedam, Grahi, and the milk is Lagu, Sheedam, and Grahi, and the diseases enlisted are the same as Ashtanga Hridaya again. So the only difference of opinion Charaga gives is Kashaya Madhura rasa. So note the differences. Study Sushruta, note the differences of Ashtanga Hridaya and Charaga, so that you can study all the 3 opinions. Now the next question is, according to Ashtanga Hridaya, the Pradimarshanasya should not be given after Devaswapna, Maithuna, Madhyavana, and Gandusha. The answer is Maithuna. The 15 kalas, Ashtanga Hridaya is asked, right? So the 15 kala of Pratimarsha is very important. Ashtanga Sangraha and Ashtanga Hridaya have said 15, while Sushruta and Sharangadhara mentions 14 kalas. Okay, so go through those. While studying the 15 kalas, you can see the use or the benefits of doing Nasya after the particular kalas. Like for Nisha, Aha, Bhukta, Banta, and Swapna. After these, if you do Pratimarsha Nasya, the benefit is Shrodo Shuddhi and Mana Prasadam. While for Adhva Shrama Retasam, after Adhva Shrama Retasam, it is Klamanasham. For Shiro, Abhyanjana, Gandusha, Kabalande, Prasrava, Anjana, and Varshas, it is Drik Balam or Drishti Prasadam. Dandakashtasya, Hasyasya. After that, you'll get Dandadadyam, Maruchama, and Saugandha. Okay. These are the benefits, and the dose is 2 bindu according to Ashtanga Hridaya, 1 or 2 bindu according to Ashtanga Sangraha. And Sushruta says, Ishat Uchingada Sneham Yavat Bhaktram Prapadyade, the time period. Okay. And an indication and contraindication is also mentioned. Extra benefits are mentioned in Ashtanga Sangraha for Pratimashanasya, like Adva Vyavaya Vyayamande, Shrama Klama Sweda Tantra Nasham, Chardidante Shrodolina Sleshma Vyapoham, and Dinante Sukhanidra Prabodham. Okay, Sushruta has said an extra point, like Grihad Nirgachata, when you leave house, when you go out, before going out, you can do this Pratimasha. Nasa Shrodasa Klinnadaya Rajoduma Na Bhadyate. That he says that if you do Pratimasha before stepping out of house, then the Nasa Shrodas will have Klinnatva, and the Rajoduma, the dust, wouldn't adhere. And Sushruta also has asked to avoid doing this after Abhyanga, then Hasyante and Vidante. That is after Varcho Nigraham and Hasyantam, Abhyangantam, it should be avoided. That is what Sushruta has said. So question number 39, according to Kashyapa, Deha Vaivarnyam is observed in Adhisara, while Vaivarnyam simply is said in Jwara. So this is from Vedana Adhyaya. It is one of the important topics in Kashyapa Samhita as well as Kaumara Bhritya. One question is for sure from this topic. As I said during the previous question paper discussion, do go through the whole topic and write out the confusion or similar looking points and prepare a confusion note. Okay. Now, question number 40. Which one of the following is not the cause of gynecomastia? Teratoma of testis, leprosy, cirrhosis of liver, and pulmonary tuberculosis. The answer is pulmonary tuberculosis. So what is gynecomastia? It is a non-cancerous enlargement of the male breast tissue. Okay, male breast glandular tissue enlarges, but it is not cancerous. It is caused as a result of hormonal imbalance between estrogens and androgens. So the causes include liver diseases, kidney failure, thyroid disease, and some non-cancerous breast tumors also. Alcohols and some drugs can also cause breast enlargement, and other causes may include syndromes like Klinefelter syndrome, metabolic dysfunction, or decline of testosterone production. Okay. And when you classify the causes accordingly, like physiological causes like neonates, puberty, senescence, in these physiological times, there can be gynecomastia. In neoplastic conditions like testicular tumors, pituitary adenoma, adrenal adenoma or carcinoma, hepatocellular carcinoma. So most of these are related to hormones, right? Specifically sex hormones. So you will have a abnormality in those leading to gynecomastia. Now endocrine disorders, again hormone related, Klinefelter syndrome, hypogonadism, hyperthyroidism. In these phases also you can find gynecomastia. Well, systemic diseases like cirrhosis, chronic renal failure, kidney and liver failures do relate in gynecomastia. Then drugs and medications like tricyclic antidepressants, estrogen therapy, spironolactone, marijuana, anabolic steroids, leuprolide acetate, thiazide diuretics, cimetidine, all these can cause gynecomastia. And other causes like obesity, malnutrition, and some idiopathic causes, all these can account to gynecomastia. Just go through that once. Now, question number 41. According to Charaga, Binna Ama Sleshma Samsrishta Guru Varcha Pravartanam is along with Kabamehasya Cha Agamaha is mentioned in which of the following? So there are two answers for this: Kabaja Grahani and Sleshmana Samvrata Apana. In both these conditions, this kind of this is given. So in Kabaja Grahani, it is said Bhinna Ama Sleshma Samsrishta Guru Varcha Pravartanam Kabamehasya cha agama kabhaja grahani smrata. This is said in Kabhaja Grahani, while Sleshma Avrata Samvrata Apana Kabham cha is mentioned. Okay. Now, question number 42. According to Sharangadhara, which of the following is the correct sequence of different layers of Sura from top to bottom? So the order is very important. Sandhana Kalpana as such is very important. The preparations from different, types of preparations are very important. Do go through that also. And 43, according to Vagbada, Bhavishyataha Kushta Samam is a Lakshana of Vadarakta. It's very important. Purva Rupa, right? Spedo Atyartam, Nava, Kashyam, Sparsha, Nyatvam, all these are similar to Kushta. That is why it is said Bhavishyataha Kushta Samam. Okay. Just give a comparative study between the Purva Rupa of Kushta and Vadarakta so that you can find a lot of similarities. And that is why it is Bhavishyataha Kushta Samam. That is, Purva Rupa Avastha, Vadarakta, it will be Uttana Avastha, right? Uttana Avastha, the manifestations are on Twak and, on the skin and Mamsa part, right? So, mostly it will resemble Kushta. Now, question number 44. According to Sushruta, wounded person may sleep in daytime. If wounded person sleep in daytime, itching in wound, heaviness in body, redness and exudation all will subside. By reading this itself, you can say both the statements are wrong, right? So both the statements are wrong. Here, the option is given as both statement 1 and statement 2 are correct. It is not right. It is not correct. Okay. So in Sushrutam Sutram, this chapter is very important. You should need to go through all those points. There are a lot of assertion reason, like why you need to have, Priya Anukula persons in Vranita Agara, and why you should not sleep during daytime. Then why you should not, do this Chadurveda Niyama, that is Utthana, Atyashana, Adhisthana, and Adishaya. There is excess of, walking, excess of sitting, excess of lying down. All these should be avoided. So the reasons are also mentioned for each one of them. So those should be, dealt with thoroughly. Okay. Now, question number 45, the National Ayush Mission, Supraja stands for. So, Supraja, the name itself indicates maternal and neonatal intervention. It was very easy. Okay, so Supraja, healthy lifestyle through Ayush for maternal and neonatal interventions. So, what is the objective of Supraja mission? It is to strengthen the maternal and neonatal healthcare interventions through Ayush systems, and also to achieve this by developing and strengthening Ayush teaching hospitals and institutes for quality maternal and child healthcare services. Now, question number 46. According to Sushruta, Balataila is indicated in which of the following disease? Yet another question from Shalake. The answer is Nasanaha or Nasa Pratinaha. So, Balatailam is indicated Sarvathaiva Upoyojyam. That is what is said for Nasa Pratinaha regarding Balatailam. Okay. So, do check all the symptoms and treatment of the given diseases again. You will get a revision. Now, coming to question number 47, consider the following statements related to eye. Sclera is the outermost coat of the eyeball. It forms posterior 5/6 of the outer coat of the eyeball. Sclerocorneal junction is also called as limbus. Sclera is also called as the vascular coat. So reading out these statements, you can simply, if you know that sclera is the outermost coat and it is avascular, D is the wrong statement, right? Just if you know that sclera is avascular, you might end up with the answer here because there is only one option with it without D. It is the option number 1. All the three all the three statements are correct, while D is wrong because it is said that it is vascular coat, but actually sclera is an avascular coat. So it's an opaque porcelain, white, inelastic, firm coat, forms the 5/6 of the outer coat. It is almost avascular, that is lacking its own blood vessels. How does it receive nutrients and oxygen then? It receives it from the surrounding vascular networks like choroid and episcleral plexuses, and also a few vessels to retina. Now, it is the outer layer of the eyeball and is externally covered by Tennant's capsule. Okay, limbus is a transitional zone between the cornea and sclera, which is the safest. It is the safest part of intraocular surgery through the mid-limbal line. Incision over the mid-limbal line is the safest area for intraocular surgery. And this the color is transparent and grayish. Uveal tract is the vascular coat of the eye. It consists of the iris, ciliary body, and choroid. Okay, so whenever you study this anatomy of certain structures, do make sure that you have a look at the most simple yet understandable picture, so that you have a picture memory along with. Okay, now question number 48. According to Charaka, Shukra Nashana is the Lakshana of which type of Vipaga? So with simple reading, you might end up with Kadu Vipaga, right? Because Shukra Nashana, Shukraha, Shukragna, all these are taken with similar meanings, right? But exactly in the shloka, Shukra Nashana is set for Amla Vipaga, while for Kadu Vipaga it is Shukraha. So be sure when you study such kind of shlokas, make sure that you study it with clarity. Okay, with the exact words. There is yet another question in the same question paper, from Ashtanga Hridaya, first chapter, Sutrasthana, first chapter, whereas this shlokam is very much, famous among, all the Ayurvedic students. Rogastha dosha vaishamyam, dosha samyam arogata, right? Then the options were Rogastha dosha vaishamyam, dash arogata was the question, and the options were Rogasatmyam, Rogasamyam, like similar options were given. So the most, confusion was between Rogasatmyam and Rogasamyam. Okay. So when you study such shlokas, be very clear what exact phrase is given there. Now, how do you make it clear? By repeated reading. Okay. Now, which of the following microorganism is majorly responsible for the condition farmer's lung? Similar question we have dealt in 2025. There I have explained all those, pneumoconiasis diseases, the size of the particle, the organisms causing, each specific diseases, all those things I have explained. Do watch that video or just give a read of your PSM note. Okay. Now, Pitara Bhagavada is accepted by Nyaya Darshana. It is, very much important. As I said before, do not, omit one complete subject. So in Padartham, if you can't study all those things, at least go through the important darshanas, the important points related to darshanas, the vadas accepted by each darshana, the pramanas accepted, the number of padarthas, etc. Those points are very much important, right? From in 2025, it was regarding Buddha darshana. Now it is regarding Nyaya darshana. Okay. Question number 51, match the list. Again, one more question from Charagam Sutram, 26th chapter, regarding the rasas, right? Predominance, the excessive usage of each rasa. So, as I said earlier, it is very important to be very thorough with the Charagam Sutram, 26th chapter, along with Ashtanga Hridaya. Okay, Ashtanga Hridaya also, has I think like 9th chapter, I guess, in Sutrasthana. There also rasas, the the characteristic features of rasas, the usage, the uses and overuse defects are all mentioned. Do give a read with that Ashtanga Hridayam also. Okay. Under which Mahakashaya, Charaga has included Arjuna. Arjuna is included in Udarda Prashamana Mahakashaya. Mahakashayas, as I said earlier, last time during 2025 discussion also I said, do not keep this Mahakashayas to the last. As I said, for Shalakya, give 45 minutes every day to read Shalakya. The same way, give at least 10 minutes to read 2 or 3 kashayas daily, so that there are 50 kashayas. Even if you read 2 kashayas a day, you can complete it one round by 25 days, right? So by the time you sit for the exam, if you have read every day 2 kashayas, then each kashaya might have a repeated reading of at least 4 to 5 times, right? So please do make sure, go for 5 kashayas daily, so that you give 10 minutes or maximum 10 minutes, 5 kashayams daily, so that 10 days you will finish one round. Again, the next 10 days, the second round, next 10 days, third round. So in a month, you will read it thrice. So you have still at least time of 3 months again, right? March, April, May, 3 months. So 1 month 3 times, then by 3 months, end of 3 months, you might have read it for 9 to 10 times. Okay. Now 53, given below are 2 statements. Adipocere change is a modified condition of decomposition in the dead body, right? It is correct, right? There is hydrolysis and hydrogenation of fatty acid in the presence of water and adipocere change. So both the statements are correct. Thanatology portion in forensic is very important. Same time, it is very confusing also. So I wouldn't say it is very, very important, but then at least the putrefactory areas and rigor mortis, alga mortis, those it would be easier if you understand what it is rather than mugging it up. It is very much important that you understand what the process is. So you better connect it to make a story out of it, and then study it, so that that story gets you a clear idea. Okay, one thing, you can make up a story and then study it, or you can relate it to some films you have seen, if you are a person who is very much interested in such kind of genres, or or no, you can not to say, you can understand the logic behind it and put some connections. Any way you can study, but then thanatology is one fairly important area where you might get a question. Okay, so since those are concepts that you can understand and study, it is better that you have a fair idea about those concepts, not to ignore it completely. Now, question number 54. According to Ashtanga Hridaya, consuming less or more quantity of food at improper time is known as. So, less or more time, it is Vishama, right? So, Vishama Ashana. So, check what is Samashana. Patya, Patyannam, Mishram Bhuktam is Samashana. Adhyashana means taking food again before the previous meal gets digested. Vishama Ashana means Bahuva, Alpam, Va Bhuktam in Agala. And these 3 are capable of causing death or dreadful diseases. So there's a slogam there, Trini api etani mrityuva goran vyadin srujantiva. Simply, if you're given this slogam and asked what it is, it wouldn't be easier to relate with this, right? So just keep in mind that this sloga comes in relation with these. Question number 55, according to Acharya Charaga, which doshas are vitiated in Alasa? Alasa, it is Kabha and Rekta. Again, from Shalakya, another question. So, regarding Shalakya, I'm not repeating it. Do you repeat the portions, but don't, I'm not repeating it, asking you to repeat again. Okay. Now, question number 56, scrotal tongue is the clinical feature of which one of the following disease? It is a feature of Down syndrome, scrotal tongue or fissured tongue. It is a oral clinical feature, a characteristic feature of Down syndrome. Okay, so Down's, Turner's, Klinefelter's, all these are very important syndromes where you might be learning it in pediatrics as well. Do learn the important features of all these Edwards, Patau's, all these syndromes. So here, scrotal tongue is tongue with multiple deep grooves or fissures on the dorsal surface. So the surface may look wrinkled or lobulated, resembling a scrotum. Hence, the older term, the scrotal tongue, is mentioned. Okay. Now, other oral and dental features are macroglossia or protruding tongue, delayed eruption of teeth, hypodontia or microdontia, the small teeth or reduced number of teeth, then high arched or narrow palate, then the thickness of palate would be small, then angular cheilitis, periodontal disease, that is gum disease, etc., would be seen in Down syndrome. Okay. Now, question number 57. Given below are statements. One is assertion. The assertion is it is generally advised to consume madhu by adding in the foods and drinks in Varsha Ritu, and the reason mentioned is Vada Pragoba occurs in Varsha Ritu. So, just by reading the assertion and reason, you can draw one conclusion that the reason is not the correct reason for assertion. Right, because honey would be never prescribed when there is a Vada Prakopa. Right, honey is Ruksha again. So, anyways, the reason is not the correct reason. So, one thing is for sure, A is not the option. Can be like B or C, right? 4 also cannot be the option because it is stated 4 can be the reason. I'm sorry, like A cannot be the choice. 2, 3, or 4, any of these can be the correct choice. Right. Now, both A and R, just think if Varsha Ritu Vada Pragoba occurs. Yes, right. So that reason statement is correct. So which means R is not correct. That is the third option is also not the answer. So now you have reduced to 2 options. Either second option or the fourth option would be the answer. Now, a fourth option can also not be the answer because madhu is advised in Varsha Ritu to be added in foods and drinks. So, with all these, you can come to the conclusion that option 2 is the answer. Sorry, I got a bit, So I hope you got it. Honey is used for Pana and Bojana during Varsha Ritu, and the reason is Kleda Shamanartham. In Varsha Ritu, Vada Pragoba occurs, but that is not the reason why honey is, advised. And honey is advised in Alpamatra. Okay, that also you have to learn. And Ruducharya, as I told you in the previous question paper also, it is very important. Learn any of, one, like if you take Charaga and Ashtanga Hridaya, they are similar, somewhat similar with, while explaining Ruducharya. So it is comparable to each other. So learn any one and then note down the difference of opinion of the other Acharya. The Sushruta, it is entirely a different genre of Ruducharya explained. So that you can study in, another level. Question number 58. Koda, Pidaga, Kandu, Gandana are the classical manifestations of which of the following type of krimi as per Madhavadana? The answer is Bahya krimi. So Madhavadana has said Abhyandra krimi lakshanam, Bahya krimi lakshanam, Kabaja krimi lakshanam, Raktajam and Purisharam. Madhavadana, the speciality is he has given 2-liners for many of the diseases, and that is actually very easy to be asked in the exam. Right. So at least for the most important portions, to go through the 2-liners of Madhavadana for those diseases. Like one such disease is Krimi, somewhat similar to Charaga Samhita. Okay. So just have a read, note down the extra points mentioned. Now, question number 59, yet another question from Dravyam 2. Here, the common names and the family has been given. So, as I said, while learning the drugs, common names are also very important along with the family. Okay, so these are to be matched. Now, Indian Jala, it is Convolvulaceae, and toothbrush tree. Toothbrush tree is Salvadoraceae, and Indian oleander is Apocynaceae, and Ceylon oak is Sapondaceae. Okay. Now, according to Kashyapa, which Prakriti is, a homework for you. Go find out the scientific names of each of these and study. Okay, now question number 60. According to Acharya Kashyapa, which Prakriti is extra in Manasika Prakriti of Rajasa Sattva? So, Charaka has mentioned 7 Sattvika Prakriti, 6 Rajasa Prakriti, and 3 Tamasa Prakriti, right? Charaka and Sushruta. Well, Kashyapa has increased 1 with Sattvika and Rajasika. Tamasa is 3 again. So Sattva Prakriti is 8 for Kashyapa and Rajasa Prakriti is 7 for Kashyapa, while extra Prakriti mentioned is Prajapatya in Sattva and Yaksha in Rajasa Prakriti. So as you know, by default, when you have an extra mentioned, you are supposed to learn the extra mentioned, right? So learn the characteristic features of Prajapati and Yaksha Sattva from Kashyapa. The other Sattvas are somewhat similar, not, I wouldn't say very similar, but still there is a bit more importance to Prajapati and Yaksha when compared to other Sattvas of Kashyapa. Okay. So with this, we come to the end of 60th question, half of 2024. So I'll be discussing the rest of the 60 questions in the next video. Okay. So thank you so much.